नमस्कार, गुड मॉर्निंग। देश के कई इलाकों में मानसून ने दस्तक दे दी है। दिल्ली सहित नॉर्थ इंडिया के कई क्षेत्रों में बस मानसून आने ही वाला है। गर्मी से झुलसते लोगों को मानसून से राहत तो मिलती है, लेकिन इसके कुछ साइड इफेक्ट्स भी हैं। मानसून अपने साथ कई बीमारियों को भी लाता है। इस दौरान लोग ज्यादा बीमार पड़ते हैं। पानी से होने वाले संक्रमण की वजह से वायरल फीवर की बाढ़ सी आ जाती है। इसके अलावा डेंगू, मलेरिया जैसी बीमारी भी सिर उठाने लगती है। एक सवाल ये भी उठ रहा है कि क्या बारिश में कोरोना के मामले अनियंत्रित हो जाएंगे, क्योंकि अभी से कोरोना के मामले बढ़ने लगे। ऐसे में सबसे बड़ा सवाल ये उठता है कि हम ऐसा क्या करें जिससे बरसाती रोगों से बचा जा सके। स्वास्थ्य की दृष्टि से हमें बचाव के लिए क्या करना चाहिए और क्या नहीं, क्या खाना चाहिए और क्या नहीं, ऐसे सभी सवालों के जवाब के लिए हमने जाने माने डॉक्टरों और डाइटिशियंस को अपने शो में आमंत्रित किया है, जो हमें बताएंगे कि मॉनसून से जुड़ी बीमारियां कौन सी हैं और उनसे कैसे बचें। हमारा ये शो अगले 3 घंटे तक YouTube और Facebook पर लाइव रहेगा। लेकिन सबसे पहले देखते हैं ये राउंड अप वीडियो। नमस्कार। आज का एपिसोड विविधताओं से भरा है। 21 जून को अंतर्राष्ट्रीय योग दिवस है, जिसे ध्यान में रखकर हमने आपके लिए योगासनों का लाइव डेमो रखा है, जिसमें जानी मानी योगा ट्रेनर आपको तरह तरह के आसनों के बारे में बताएंगे। आज के शो में थैलेसीमिया जैसे रेयर डिजीज और ब्लड ट्रांसफ्यूजन के विभिन्न पहलुओं पर भी चर्चा करेंगे। हमारे विशेषज्ञ बताएंगे कि इस बीमारी के लक्षण और कारण क्या है और क्या इसका पूर्णतः उपचार संभव है। थैलेसीमिया से पीड़ित रही विशेषज्ञ आज अपना अनुभव भी साझा करेंगे। इसके अलावा लोगों में, खासकर युवाओं में बढ़ती आयरन डेफिशिएंसी की समस्या पर भी बात करेंगे, जो आजकल हमारे देश में विकराल रूप ले रहा है।
We kickstart this session with yoga.
Today's session, we will be doing yoga along. I'll not be just telling, we will be doing yoga along, how it is so beneficial for your physical health, mental health, your connection. So yoga is nothing but connecting with your breath. That's what sets it apart from the other exercise form, okay? And the connecting with your breath, you have so much control better in your emotions. And when you are emotionally so well, you get physically also so well, because all your diseases are at least 50-60% of them comes from mental health. Okay, so the only thing we both will do right now is chant Om 3 times and 10 long deep breath. Okay, let's close our eyes and chant Om 3 times and 10 long breaths. That's all. Okay. Come back to your body, eyes closed. Relax yourself completely. Smile on your face. Let's take a long deep breath in and breathe out. One more breath in and breathe out completely. Let's bring both the palms together right in front of your chest. Take a long deep breath in for Om, and while expiring, we will chant Om. Okay, so inspire. Om. Om. And relax completely. Keep taking long deep breaths in and out. Breathe in and breathe out. As we breathe in, we bring energy into our life. As we breathe out, we relax completely. Your whole attention towards your breath. For 1 minute, stop thinking about what's going to happen, what's not going to happen. Just connect with your breath completely. Don't allow a single breath to get unnoticed. Long deep breath in and out. Very slowly, coming back to your body, breath and surrounding. As you feel comfortable with a smile on your face, let's rub both the palms together and slowly open our eyes.
We now move on to this particular session on blood transfusion and thalassemia.
नेहल जी, आप अपने अनुभव से बताएं कि क्या इस बीमारी से कोई बिहेवियर चेंज होता है किस तरह का होता है, कोई पर्सनालिटी में चेंज होता है?
थैलेसीमिया एक जेनेटिक बीमारी है, तो बचपन से ही आपका डायग्नोसिस हो जाता है। कई बच्चों का 2 महीने में, कई बच्चों का 6, 7, 8 महीने, मतलब मेजॉरिटी थैलेसीमिया पेशेंट्स 1 साल के होने से पहले से ही रक्त लेना रेगुलर इंटरवल्स पे, रेगुलर से मेरा मतलब है हर महीने या महीने में 2 बार उनको ब्लड चढ़ना स्टार्ट हो जाता है। और इसके साथ स्टार्ट होता है एक साइकिल तनाव का, एक साइकिल आपका जो रूटीन है वो सेट नहीं हो पाता है। आप स्कूल जाते हैं पर आपको बीच बीच में छुट्टियां लेनी पड़ती हैं क्योंकि ब्लड चढ़ना है। आपके साथ में इम्यूनिटी कम होती है तो कोई ना कोई इन्फेक्शन लगा रहता है, जिस वजह से वो बच्चा स्कूल में या एक नॉर्मल इंसान के रूटीन में, लाइफ में ढलना बहुत मुश्किल हो जाता है। तो इसके साथ, इसके चलते मेंटल हेल्थ उस बच्चे की बहुत अफेक्ट होती है। तो जैसा कि आपने पूछा, बिहेवियरल या पर्सनालिटी चेंजेस वो बच्चे में आएंगे ही। अगर एक आम इंसान भी, मैं एक नॉर्मल इंसान की बात करूं, उसको भी 3 दिन से ज्यादा बुखार हो जाए तो उसकी भी पर्सनालिटी में चिड़चिड़ाहट या मन ठीक नहीं रहता। पर ये तो हम एक लाइफ लॉन्ग बीमारी की बात कर रहे हैं। तो इनका ऐसा ज़्यादा खेलने मत जाओ धूप में, तुम स्पोर्ट्स में नहीं जा सकते। बच्चों के लिए सबसे इम्पोर्टेंट स्कूल में पीरियड होता है गेम्स पीरियड, लेकिन अगर उस पर भी रोक लगा दी जाए कि ज़्यादा मत खेलो, तुम्हारा हीमोग्लोबिन कम हो जाएगा, ब्लड की ज़रूरत पड़ेगी, ऐसा मत खाओ, इसमें आयरन बढ़ जाएगा, ऐसा मत करो, तो इतनी रुकावटों के बाद वो बच्चे का पर्सनैलिटी में चेंज आना या बिहेवियर में या मेंटल हेल्थ पे एक स्ट्रेस और जो प्रेशर, जो फ्रस्ट्रेशन बनेगा, वो तो जायज़ है और होगा ही। कितने बच्चों के सपने पूरे नहीं हो पाते, ऑस्टियोपोरोसिस हो जाता है, आर्थराइटिस हो जाता है क्योंकि बोन हेल्थ कमज़ोर हो जाती है, कितनों के हार्ट इश्यूज आ जाते हैं, लिवर इश्यूज हो जाते हैं, रीनल किडनी इश्यूज हो जाते हैं। हर एरिया, मतलब आप चाहे हेपेटिक ले लीजिए या रीनल किडनी रिलेटेड ले लीजिए, स्प्लीन रिलेटेड ले लीजिए, बोन रिलेटेड ले लीजिए, हर एरिया पे थैलेसीमिया हथौड़ी सा मार करता है और वो सब उस बच्चे के दिमाग पे आता है।
What is beta thalassemia major and why do these people have shorter lifespan?
Google is still saying thalassemia beta has a shorter span of life because I am 44 and many of my friends are like near to 60. So I don't believe in such things because I believe the currently treatment is available, which is very nice and very great. If you are going with the good guideline and with good treatment, so I don't feel कि there is a lifespan for thalassemia. What I believe. And अगर आप जैसे मैं रूरल डेवलपमेंट एरिया में भी जाती हूँ लेक्चर्स के लिए, तो वहाँ पे जनरली लोग बच्चों को सिर्फ ट्रांसफ्यूजन देते हैं, तो दे फील ब्लड देना ही जरूरी है। तो ब्लड देना सिर्फ जरूरी नहीं होता, उसके साथ रेगुलर टेस्टिंग कराना है, रेगुलर डॉक्टर्स के विजिट्स करने हैं, उसके चिलेशन थेरेपी देना है, अगर विटामिन मिनरल्स कुछ कम हुए तो वो बैलेंस करना जरूरी है। तो जब आप गाड़ी को पटरी पे प्रॉपर वे में ले आओगे तो वो बहुत अच्छी चलेगी, उसका गाड़ी का माइलेज अच्छा चलेगा। अगर उसका पेट्रोल टाइम पे आप ट्रांसफ्यूशंस दोगे, हीमोग्लोबिन अच्छी तरह से 12 मेंटेन करेंगे तो क्यों नहीं चलेगी। बिकॉज आई बिलीव कि थैलेसीमिया में सिर्फ एक आरबीसीज की कमी होती है, जो ब्लड ट्रांसफ्यूजन से आरबीसीज हम पूरी करते हैं, फिर आरबीसीज से क्योंकि आयरन बढ़ता है तो हम चिलेशंस देते हैं। सो इट्स अ बैलेंस ट्रीटमेंट। सो आई डोंट बिलीव कि देयर इज any life expansion for thalassemia.
The next session is on diet iron deficiency in young adults.
बच्चों और युवाओं का क्या करें? जो चीजें आप लोग मना करती हैं, बच्चों को वही पसंद है। जो आप खाने को कहती हैं वो खाना नहीं चाहते। उनका डाइट प्लान कैसे बनाएं? हम लोग पेरेंट्स के लिए ये बहुत मुश्किल काम है, कैसे बनाएं और कैसे उनको कन्विंस करें, क्योंकि वो ज्ञान की बातें नहीं सुनना चाहते।
नहीं, वो तो सही है। एक तो जो है सिंपल चीजें हैं, जो कुछ चीजें जो है आयरन एब्जॉर्प्शन कम भी करती है, जैसे ड्रिंकिंग अ कोला बेवरेज और ईटिंग इट विद अ कैल्शियम रिच फूड, या ईटिंग इट विद अ लॉट ऑफ जंक फूड। तो ये जो बहुत रिफाइंड फूड्स होते हैं, एक तो इन दोनों को सेपरेट कर देना चाहिए। दूसरी चीजें हैं जैसे ग्रीन लीफी वेजिटेबल्स, अगर बच्चों को नहीं पसंद है तो सिंपल रेसिपी, एंड दिस इज समथिंग व्हिच आई आल्सो यूज एट द नेवी, इस जैसे करी पत्ता का पाउडर, करी पत्ता है, हम इसको जो है ड्राई रोस्ट करके इसको हम पाउडर कर देते हैं। तो इवन इफ यू ऐड 1 टीस्पून ऑफ इट, पत्ता बच्चा निकाल नहीं सकता। उसी तरह जैसे अदर ग्रीन लीफी वेजिटेबल्स लाइक पालक, मेथी, यू यूज इट इन डिस्गाइज्ड फॉर्म। तो जैसे अगर हम पालक पास्ता बनाते हैं तो अच्छा उनको ठीक लगता है, दे फील हैप्पी, राइट। और मेथी, कसूरी मेथी की अगर हमने पूरियां बना दी, एंड फॉर चिल्ड्रन ओके फैट इज नॉट सो मच ऑफ अ कंसर्न, देन दे लाइक टू ईट इट। So feeding it in attractable formats also is very important to them. और बच्चों में ये जरूरी भी है, क्योंकि ये डायरेक्टली देखा गया है कि जैसे जैसे बच्चे कम आयरन खाते हैं, इनके स्कूल परफॉर्मेंस के ऊपर, इनके साइंस और मैथ्स के स्कोर के ऊपर डायरेक्ट इसका इम्पैक्ट होता है। स्पोर्ट्स फील्ड में भी ये बहुत अच्छे से नहीं कर पाते, समटाइम्स दे आर वेरी टायर्ड, and at that time nobody thinks of the tiredness, they think about the body image कि मैं खेल नहीं पा रहा हूँ, मैं हमेशा रेस में लास्ट आता हूँ। So it is also creating a lot of psychological impact.
Sometimes it is said that vigorous exercise also can lead to iron loss. Is it true?
Yes, it's true. Because when where all iron is absorbed. Like, what is the function of iron? Iron is like it forms a small good part of hemoglobin. At the same time, in muscles, it is present as myoglobin. So when you do very vigorous exercise, your myoglobin doesn't get proper iron in your body, or iron get leaked from your muscles and it comes out. So you are supposed to be eat iron-rich food before doing vigorous exercises. This is one of the reasons sports personnel, young, especially adolescent sports personnel, they are always anemic and they get tired very fast. You will be surprised to know that why Indian athletes are not able to perform better on international arena, because they don't eat good food, good, nutritious, balanced food. Everybody feels that we are dietitian. Through Google, we know what we are supposed to eat, but every individual is different. Their body requirement is different. If they are practicing for 5 hours or 6 hours, their nutrient requirement, nutrient requirement is very different. So they are supposed to have proper nutrient rich food according to their physical activity.
Great Moringa project, of having drumstick leaves and saplings to be planted in states like Bihar, Chhattisgarh, and other places. Now, is there we have of course planted all these things, but is there any outcome saying that the anemia has reduced because of that? There is an improvement in this whole thing.
There has definitely been an outcome, but I think lot more work on awareness building needs to be done, because today when we look at our population, almost 51% of Indians are anemic, and that's like a huge statistic. And it's not only rural India but also urban India. And earlier we whenever we spoke about anemia, we only connected with females, but today we are seeing equal amounts of anemia even in males. And so it is a matter of concern, and I think so not only Moringa, but I think the government needs to, and also health professionals like us, and I think this channel and whatever you all are doing is great, because this awareness needs to be built into people, that people genuinely need to eat more iron, vitamin C, and not an important part whenever we talk about iron, vitamin C, folic acid. Us as Indians also eat very little protein, right? And so we say hemoglobin. So it's iron, heme is iron and globin is protein. So one of the reasons why we suffer with low hemoglobin is also that overall our muscle mass is less. We are sarcopenic Indians. We eat less proteins. So there is no carrier for the protein. So I think this, like even Divya mentioned before, that we need to emphasize on a balanced diet. So whilst we keep talking about iron, folic acid, vitamin C, but eating healthy amount of proteins also is a part of the deal.
Welcome back. I am Shankar Raj, President of the Heal Foundation. We start the 37th episode of Health for All with yoga, and we have with us a popular expert, Dr. Pooja Pandey, a certified yoga teacher, an expert in aerobics and Zumba, and runs Arogya Physiotherapy, combining all these techniques. She is also the creative spirit behind her successful YouTube channel called Arogya Physio Tips. Let me remind our viewers that we are live on Facebook and YouTube. Welcome, Dr. Pooja Pandey. Nice to see you again on a Sunday, which is the last Sunday of this month. I think wonderful seeing you, and over to your session.
I am thinking that now we are so used to each other that every Sunday morning starts with Shankar, right?
No, actually it starts with Kishore and I come in between after that. But our session
for me, it's Shankar and Kishore.
Yes,
starts with both of you.
Yes. Welcome. Yeah.
Okay. So today I'm going to talk about yoga for monsoon. That means it's raining everywhere. And if it is not raining, it will start raining very soon. So how to take care of your health during monsoon season? Because I don't know about other places, but Bangalore is anyways full of right now with viral, with cold and cough, with stomach upset. All these things are happening all over in Bangalore. And that's because it's already raining here. So how to take care of your health when it's raining outside? One very important thing you need to take care is your hydration. So what happens when summer is there, we automatically feel thirsty and we drink a lot of water. But that is not the case during winters and during the monsoon season. Okay, you don't feel so thirsty. So you end up drinking less water. So always remember, I have told this before also, 20 kg is equal to 1 liter of water. अगर आप 20 kg के हैं तो आपको 1 लीटर पानी पीना ही पीना है. तो समझ लीजिए अगर आप 80 kg के हैं तो आपको 4 लीटर पानी पीना है. तो आप अपने वेट के हिसाब से पानी पीजिए हर रोज. ओके, वो पानी किस तरीके से पी सकते हैं? पानी आप प्लेन वाटर पी सकते हैं. अगर आपको चांसेस ज्यादा है कि आपका गला जल्दी खराब हो जाता है या नोज जल्दी आने लग जाता है, नोजी, तो अगर आप ऐसा करिए कि वो थोड़ा कुनकुना पानी पीजिए. दैट मीन्स नीदर इट्स बॉइलिंग हॉट नॉर इट इज कोल्ड. कुनकुना पानी. ओके, अ मीडियम हॉट water is something which you should consume throughout the day. And you can even have nariyal pani, because again so try drink. And even if you want to drink juice or anything like that, make sure that you make it at home and not outside. Don't try to eat lot of raw like juices or salads and all that. Please don't try to eat that outside, because it may not be good for your stomach. As you know, monsoon is a breeding time for bacteria, so it's very important that you eat at home. दूसरे बहुत important चीज जो इंडियंस में होता है कि बारिश हो गई है तो पकोड़े खाना है, समोसे खाना है, ये तो माहौल बन रहा है. तो अगर आपको पकोड़े और समोसे खाना है तो मेक श्योर दैट यू आर डूइंग इट एट होम. बाहर नहीं. बाहर का खाना आपको जितना अवॉइड कर सके उतना अवॉइड करें. और अगर खाना ही है तो मेक द गुड कुक्ड फूड, नॉट एट ऑल मतलब विच इज कंप्लीटली हीटेड, नॉट द फूड विच इज कोल्ड. Okay, because that is again a breeding area. Make sure your home is clean all the time during monsoon, because again and if you get cold and cough or anything like that, immediately start working on it. Meet your doctor immediately. आप वेट नहीं करिए कि आप वेट करेंगे कि अच्छा जब फीवर हो जाएगा तब जाएंगे. नहीं, उसी वक्त एक्ट करिए, बहुत जरूरी है. नाउ चौथी बहुत इंपॉर्टेंट बात जो है, तो ये था खाने और पीने की बात. विटामिन सी, अभी मैं वीडियो भी देख रही थी, विटामिन सी का सेवन ज्यादा करिए. तो मैं तो हमेशा रिकमेंड करती हूँ कि अगर आप इंडिया में रहते हैं तो आंवला अवेलेबल है आपके पास, और आंवला आप रोज 1 से 2 सेवन करिए। अगर आप ऐसे नहीं खा सकते हैं तो आप इसको एक्चुअली मिक्सी में पीस भी सकते हैं और पेस्ट की तरह खा सकते हैं, और उसको ग्लास की बॉटल में आप 4 से 5 दिन रख सकते हैं फ्रिज में। ओके, तो आंवला बहुत अच्छा है। अगर आप आंवला एकदम भी नहीं खा सकते हैं तो आप संतरे का जूस या जो भी जूस अवेलेबल है विटामिन सी फॉर्म में, वो ज्यादा विटामिन सी रिच फूड खाइए। और दूसरा लिमसी करके टैबलेट होता है विटामिन सी का, आप वो भी सेवन कर सकते हैं। तो बच्चों को और खुद को अच्छे से विटामिन सी दीजिए। ओके, नाउ 5वीं सबसे इंपॉर्टेंट बात, क्योंकि बाहर बारिश हो रही होती है और बहुत अच्छा मौसम हो रखा होता है, तो आधे लोगों का एक्सरसाइज करने का मन नहीं करता कि अच्छा अभी बारिश हो रही है, हम तो जिम नहीं जा पाएंगे, या बारिश हो रही है, हम क्लास नहीं अटेंड कर रहे हैं। तो याद रखिए कि आपके घर में अगर एक योगा मैट अवेलेबल है तो आप घर पर ही बहुत सारी एक्सरसाइजेस कर सकते हैं। पहले मैं उन एक्सरसाइजेस के बारे में बताना चाहूंगी जो बेसिकली आपके इम्यून सिस्टम को बेटर करता है, और अगर मान लीजिए आपको माइल्ड कोल्ड एंड कफ है तो वो आपको उससे भी रिलीफ देता है। ओके, सो द फर्स्ट एंड फॉरमोस्ट व्हेन इट कम्स टू monsoon, then you have to take care of your lungs, and when you have to take care of your lungs you have to do pranayam. Okay, so nadi shodhan pranayam और कपालभाति प्राणायाम, मतलब कि alternate nostril pranayam and the kapalbhati pranayam, which is basically the abdominal breathing, is very very good and should be done every single, at least these two pranayams should be done every single day during monsoon. Okay, when I say nadi shodhan pranayam, you should be doing it for 2 to 5 minutes continuously. When I say kapalbhati pranayam, you should be doing at least around 100 breaths. If you're not able to do 100 breaths, then you break it up 30 30 30. Okay, but you have to do 3 rounds of kapalbhati, that means 30 30 30, and you have to do nadi shodhan pranayam. For people who have been following it, they already know alternate breathing and kapalbhati, but if you are new to the channel and you're watching it first time, तो मैं आपको demonstrate करके बताती हूँ। मैं हिंदी और इंग्लिश मिक्स कर रही हूँ, जिससे कि अगर आप हिंदी नहीं समझ पाए तो अंग्रेजी समझ लें, और अंग्रेजी ना समझ पाए तो हिंदी समझ लें। तो अल्टरनेट नॉस्ट्रिल ब्रीदिंग के लिए बहुत इंपॉर्टेंट है कि आप एक्टिव नॉस्ट्रिल को पहले देखिए। एक्टिव नॉस्ट्रिल का मतलब क्या है कि एक नॉस्ट्रिल से आप हमेशा ज्यादा ब्रेथ ले पाएंगे कंपेयर टू द अदर नॉस्ट्रिल, और ये रोज चेंज होता रहता है। तो ये मत सोचिए कि आज अगर मेरा लेफ्ट नॉस्ट्रिल खुला है तो कल भी मेरा लेफ्ट नॉस्ट्रिल ही खुला होगा। तो आप पहले एक्टिव नॉस्ट्रिल देखें, फिर 2 फिंगर्स को इन बिटवीन द आईब्रोज रखें, 2 fingers closing your left nostril and thumb closing your right nostril. So now my left nostril is open and my left hand is in chin mudra. Okay, this is chin mudra. So it's gently, and don't press it very hard. It is very gently kept. Okay, so you breathe in from the active nostril and breathe out from that. Breathe in from same. Breathe out from other. तो अगर मैंने लेफ्ट नॉस्ट्रिल से शुरुआत की है तो लेफ्ट नॉस्ट्रिल पे ही एंड होगा। दिस इज 1 साइकिल ऑफ अल्टरनेट नेजल ब्रीदिंग और आलोम विलोम प्राणायाम। सो व्हाट यू हैव टू डू इज यू हैव टू डू द सेम थिंग फॉर 2 to 5 minutes. ओके, नॉट ओनली, अच्छा कई लोगों का नोज ब्लॉक हो जाता है मॉनसून में। अगेन दिस हेल्प्स इन ओपनिंग अप योर नेजल पाथवे। वहां पे भी ब्लॉकिंग चालू हो गई है, वहां पे ही आप नाड़ी शोधन प्राणायाम या आलोम विलोम प्राणायाम शुरुआत कर दीजिए, तो आपका ब्लॉकेज खुल जाएगा। इसके अलावा आप रेगुलर बेसिस में स्टीम और गार्गलिंग कर सकते हैं। स्टीम से अगेन योर लंग विल ओपन अप व्हेन यू इनहेल द स्टीम, और दूसरा गार्गलिंग से आपका थ्रोट ठीक रहेगा, क्योंकि बहुत लोगों के गले बैठ जाते हैं मॉनसून के टाइम पे। तो और जब आप गार्गल कर रहे हैं तो थोड़ा सा उस पानी में हल्का सा सॉल्ट डाल दीजिए, विच विल बी वेरी वेरी गुड। Now, second is Kapalbhati Pranayam. Kapalbhati Pranayam is very good for morning. It is basically releasing a lot of toxins from your body and activate all the breathing muscles, including the abdominal muscles. Abdominal muscles are the accessory muscles for breathing. Okay, मतलब वो diaphragm is your main muscles and abdominal muscles are the accessory muscles. तो इसलिए आप ऐसा करिए कि कपालभाति करिए. कपालभाति करने के लिए आप पहले you will connect with your breath, which is very, very important. प्राणायाम में बहुत जरूरी है कि you should connect with your breath. That means close your eyes and pay full attention to your breath for some time. And only when you are connected with your breath and none of the breath is getting unnoticed, मतलब कि आपकी कोई भी, जब आप सांस अंदर ले रहे हैं या बाहर ले रहे हैं, आपको अच्छे से पता चल रहा है कि सांस कहाँ तक पहुंच रही है, कैसे जा रही है. जब वो कनेक्शन बैठ जाता है आपके ब्रेथ के साथ, तभी आप प्राणायाम करें. ओके, तो कपालभाति, यू टेक अ नॉर्मल डीप ब्रेथ इन and breathe out. In Kapalbhati, breathe in. So, you have to understand that when you do Kapalbhati, you take a normal deep breath in. जब आप सांस अंदर ले रहे हैं तो खास कोई साउंड नहीं है. जब आप सांस बाहर छोड़ रहे हैं तो यू आर यूजिंग ऑल द मसल्स टू टेक इट आउट. तो बहुत तेज नाकों से आवाज आती है. अगेन, अगर आपका ब्लॉक्ड नेजल पाथवे है तो इट विल ओपन इट अप. ओके, मेक श्योर दैट इफ यू आर हैविंग कोल्ड और कफ and if you're not feeling so well and you are doing this pranayam, you should be alone in the room, because then you will spread all the bacteria around. Okay, so if you're having cold and cough, तो आप घर पे या रूम बंद करके खिड़कियों को खोल के अकेले करिए. तो ये हर रोज करना है, नाड़ी शोधन प्राणायाम और कपालभाति प्राणायाम. इसके अलावा एक बहुत अच्छा आसन है जो बेसिकली will open up your lungs and help you ease down your breath. That is downward dog position. Okay, downward dog position या अधोमुखा आसना हम सूर्य नमस्कार में भी करते हैं और मैंने बहुत बार किया हुआ है, फिर भी मैं आपको डेमोन्स्ट्रेट करके दिखाऊंगी. आप बेसिकली यू कम ऑन ऑल फोर, या फिर इसको क्रॉलिंग पोजीशन बोलते हैं. मैं थोड़ा सा मैट को पीछे ले जाती हूँ जिससे कि आपको अच्छे से दिखे. तो you are in crawl position, your shoulder and wrist in one straight line, okay, and your hip and knee at one straight line. Okay, अगर आपको सीखना है कि क्रॉल पोजीशन सही करेक्ट वे में कैसे करते हैं, तो आप बेसिकली वज्रासन में बैठ जाइए. वज्रासन में बैठ के आपके एल्बो को नी के साथ रखिए. ये जो डिस्टेंस आपका एल्बो और रिस्ट के बीच में है, उतना डिस्टेंस दोनों तरफ रख के, ओके, एंड यू बिकम, दिस इज द करेक्ट क्रॉल पोजीशन. सो दिस इज हाउ यू कम इनटू क्रॉल पोजीशन. अच्छा, अभी आप इस क्रॉल पोजीशन में है. आप क्रॉल पोजीशन में रह के आप अपने पैरों को टक इन करिए, मतलब टोस को टक इन करिए. टोस को टक इन करके एंड यू कम इनटू डाउनवर्ड डॉग पोजीशन. आपका heel is touching the ground. Okay, now let me show you. If your heel is up, try to take it to the ground as much as possible and try to take your nose towards the center of the knee. Okay, both them, and you hold. Now इसमें क्या होता है कि because your lung is not against the gravity, आपको थोड़ा सा you can breathe better. So keep breathing in this position for 2 minutes, 1 minute when you're feeling breathless or your nose is blocked and you're not feeling so okay. This is very, very good to open up your lung and help you breathe better. Okay, that's how it is important during monsoon. Dusra, again in crawl position only. Breathe in cat, cow. Okay. तो इसको कैट एंड कैमल भी बोलते हैं, कैट एंड काउ भी बोलते हैं. ब्रीद इन अप, ब्रीद आउट, ब्रिंग इट डाउन. ब्रीद इन अप, breathe out, bring it down. It is important that when you breathe out, your back should go up, and when you breathe in, your chest should open up. Okay, so you can breathe better. Breathe in, breathe out. Okay. दूसरी आसना जो बहुत अच्छी है ड्यूरिंग मॉनसून, इट्स सेतु बंदासना और ब्रिज पोज. अगेन इट ओपन्स अप योर lung and it helps you, it actually stimulates the T cells, okay, and it also stimulates the thymus gland, so it is very, very good for your throat also, and for your lungs also, and for your immunity also. So Setu Bandhasana or bridge pose, for that we have to get into lying down position. I always recommend that if you don't have strong core, मतलब कि आपके पेट के मसल्स अगर बहुत स्ट्रांग नहीं है, तो आप हमेशा लेटते साइड से लेटिए, हमेशा साइड से लेटिए और फिर सीधा लेट जाइए. ओके, so you are here and you can just bring both your hands and clasp it. Okay, bring both your hands and clasp and take it up. Breathe in, take it up. Okay, look up and hold it. 1, 2, 3. Make sure your knees are not going out. Knees are in, hip length apart. Your knee is. Okay, 1, 2. Don't hold your breath. Keep breathing. 3. And try to open up your lungs as much as possible. Okay. Now I have very long hair, which is not allowing me to take my head little back, but this is very, very good. Okay. And hold it for 10 seconds and relax. And you can do 10 to 20 repetition for this. Okay. Which will be very good. Next is Matsyasana or fish pose. Again, it opens up your lung and it actually helps you in breathing better. Okay. Now, these are the asanas which I am completely recommending that if you have mild symptoms, you can definitely do this. You will feel better. Okay. For fish pose, your both the legs will be straight onto your elbows. Okay. So you are here. Your shoulder is relaxed. So you're not doing this. Your shoulder is completely relaxed. And then try to take your head as back. Again, see, it's stimulating your neck muscles. It's stimulating your chest. Okay. So, here. Keep breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. Okay. So, fish pose is very, very good if you do while you have mild symptoms. Always remember, it has to be the mild symptoms. Another thing which is very, very good is basically your, I will just show you. So you basically get into sitting or get into standing and try to open up your lungs. Okay. This can be done in sitting or standing. So you bring both the hands together. Breathe in, open up your lungs. Breathe out, take it back. Breathe in, open up your lungs. Breathe out, take it back. Breathe in, open up your lungs. Breathe out, take it back. Breathe in, open up your lungs. Breathe out, take it back. Similarly, clasp both the hands together and take it all the way up. Okay. Breathe out. Take it to the side. Breathe in. Breathe out. Take it to the side. Breathe in. Now this will open up your sides. Okay. Very important is when basically there is a lot of congestion in the lungs, what happens? You don't use the sides. So to open up the sides, what you will do is basically take it all the way up. Take it to the side. Bring it back. Take it to the side. Bring it back. Okay. You can also do Trikonasana, which is basically the triangle pose. Again, the whole point is to open up your lungs. So what you will do is we can stand up. I have told you how to stand up. in the neutral position where you don't have to do this and that. You come onto your knees, okay? And you take your left leg forward, you take your right leg forward, and that's how you stand. Trikonasana, both the hands are straight, and breathe in, breathe out, and you basically go to the side. Keep breathing again to open up your side, and breathe out, come back, breathe in, breathe out, take it all the way back. Okay, and keep breathing in and out. In none of the poses, you are basically holding your breath, okay? And your chest all open up in one straight line and come back, okay? Another thing which you can do is basically warrior pose second. So this is basically warrior pose 1. Third. The third warrior pose. So this is 1, this is 2. When you basically take the hands all the way up and look up. Okay. Warrior pose 3 is also very good. Again, opening up your lungs, stimulating your thymus gland, and bring it back. Now, in warrior pose, what is happening is your ankle is slightly away than the hip. So it's not in hip level, it is slightly. Your one leg will be facing forward, one leg facing to the side, and whichever side you are, bending towards, your knee will slightly bend. So your knee will bend, then bring both the hands together and take it all the way up. So warrior pose 3. And keep breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. Okay. So these are few of the poses which can help you in when you are, your lung is congested and all that. Another thing which is not related with your cold and cough is, as I said, that if you are not able to go to your gym or yoga studio or wherever you are supposed to go for your workout because of the heavy rains outside, then you can definitely do yoga at home at your own comfort if you have a yoga mat, that's all you need. So you can actually do Surya Namaskara. If you know that I have demonstrated multiple times Surya Namaskara in this session. Now, how can Surya Namaskara be just done and the whole workout can be done? Very beautiful thing about Surya Namaskara is if you do Surya Namaskara in a very slow manner, it will help you improve your flexibility. If you do it at the medium pace, okay, it will help you improve your strength. And if you do it very fast pace, then it will help you in a cardio endurance activity. Okay. So you are basically now being a yoga person as well as a physio, I can put both the knowledge together. So actually Surya Namaskar can be used to just do cardio if you were used to going for a walk of 40 minutes, okay, then just do a fast, Surya Namaskara for say 20 counts or 40 counts, whichever is possible for you. And you will see yourself sweating and, huffing and puffing, you'll be out of breath because the Surya Namaskara actually improves your cardio endurance. And if you are used to doing weights in the gym, you try doing, Dandasana. That means all the plank pose, which will help you. So calisthenics is basically using your own body weight, and yoga does that. So that will take care of your strengthening part. And when it comes to flexibility, yoga is the key. You need to, just breathe into a pose and keep holding it for a longer period of time, and it will help you improve your flexibility. So not only yoga will help you to come out of your symptoms, it will also help you to improve your immunity and not cut on in your exercise routine during monsoon season. So even if you're not able to go out and work out in your group classes, do it individually at home. I have a channel called Arogya Physiotips, which has a lot of yoga videos as well. And there are so many videos available online. If you want to just, do a guided whole yoga class, you can do that as well. So, but don't stop yourself from working out, because when you work out, again, your, immunity improves, which actually helps you to go through the whole monsoon season. So make sure that you are doing your pranayam, make sure you're doing your yoga, make sure you are not missing on your workout, make sure you're eating home-based cooked food, okay, less of raw food, and make sure that your vitamin C is all boosted up, make sure your hydration is high, okay. So these are the things from my side. There is another thing which I really want to emphasize during monsoon is many people, so because of monsoon, people don't go out so much and they stay at home, and there's more fights happening and there's a lot of stress at home. So make sure that as a family, you should meditate together and stay stress-free. You can just lie down in Shavasana and take your whole attention to your breath, and that's about it. You are in meditative mode already, okay? So meditation, pranayam, and yogasanas together will make sure that your monsoon goes well.
Thank you, Dr. Pooja. I was quite surprised to learn that monsoon is also a season of fighting. I didn't know that.
Because it's a breeding season for bacteria. There is clogged water everywhere.
No, I mean where people in the house start fighting during monsoon. I was
yes, see what happens because of monsoon. See why COVID has the maximum divorces, and why because people are not going out. So when they stay together, they fight. So instead of fighting together, meditate together.
Now, one question I wanted to ask you is, most of the people sometimes, what happens is when they go out, they get wet, especially yes. When you don't carry an umbrella, or you feel like you believe the weather forecast suddenly and it starts raining. So when you get wet and when you come back home, what should actually be done? Are there any yoga things or exercises or some other things that can really protect you?
So one thing is actually during monsoon, try to carry your umbrella or protective gear all the time in your purse or bag, which is very important. But if you're not able to your mind and or sometimes just children want to enjoy the rain, and so make sure that it is not the first few rain, which is very, very harmful, okay. And even if they get wet, immediately they need to go and take bath from hot water, okay. When I say hot water, doesn't mean burning hot water, but slightly hot water, and they should change immediately to the dry clothes and take steam. That itself will make sure that they don't catch up cold, okay. Most of the people actually what they do is they come back, they dry themselves, but they don't take bath, neither they take steam, which end up making them the next day they are down with cold, okay. So these two things if they do and come back, and when after the steam anyways the nostril pathways is open, just do few rounds of pranayam and I'm telling you, you won't catch cold.
I will just bring you to a small tradition that happens in Tamil Nadu. I don't know whether it is there in Karnataka. What happens is especially in villages, I'm not speaking about towns and cities. When the first rain comes, first few days, mothers send out their children for getting wet. And the belief is that they can get immunity. So they ask them to play in the rain, and when they come back, their hot water or warm water with neem leaves are kept ready, and they have a bath. And this protects them for quite some time. There was a study also which shows that the level of immunity improves, or they don't have cold and cough like children in the cities. So what do you have to say about this?
See, I'm not aware of the tradition, but yes, like how we encourage children to play in the mud, and there will be women who will tell, the child has played in the mud, go wash your hand, and what you need to expose your child areas also. Okay, but that is not the case with the adults. Okay, that is not the case with the adults. Children are still developing. It is very important for children to get cold, cough, fever. Very important. If your child has not got cold, cough, fever, that means his immunity will not build up, or her immunity will not build up. So you need to expose. Any mother who come to me and say, my child is getting cold, cough, fever, I said, is he or she in the bracket of 0 to 7 years? Yes, then it is a good thing for you. Celebrate it. 3 days of no sleep, but you do it. And I always tell the mothers that not to put on antibiotic to the child till at least the first 3 days. If the fever goes off in first 3 days, then get up in the night and give crocin and just manage it just with the plain crocin and just putting on some cold cloth on the head and just that, because mom panics. Because these children, they don't get fever like 99 or 100. They generally get 102, 103 fever, which is literally high. But the children will get it. Okay. And it's good to build up immunity. So I would agree with though I am not aware of it, but I 100% support what you are saying. And especially when they come back and you give bath from the neem leaf water, it will anyways, because neem is like the biggest antibacterial, antiviral. For anything, neem is good. Okay. So yes, it should build up their immunity. I totally agree with that.
It is said that you don't catch the same cold in life, and the moment you start getting cold right in the beginning itself, especially children, it's a mechanism to build the immune system. Is that right? You keep on building the immune system, and then
yes,
probably that's why elders don't get that much of cold.
Yes.
Whereas children, they get cold.
But because we were exposed to all the cold and cough and fever and all that. But today's parents are little finicky. They put antibiotic much faster. They put, even there's so many children who must be taking steroids as well. Okay. Because a lot of, especially in Bangalore, a lot of children are born with asthma, because of the weather we have here and the pollen we have here. They get exposed to allergic asthma faster. And for asthma, a lot of, parents expose them for steroid. But I always say do nebulization, even if you have to do throughout the night, and be patient, and it will go off. But if you start on steroid, it will stay for a very, very long time.
And one important message is that the moment the child has a fever, there is a tendency to rush to paracetamol and control the fever. Whereas if the fever is about 100, 101, it's quite normal because the body is fighting the bacteria. So it's better to leave that way. Is that right?
Yes. Yes, I agree with that. I always wait for fever to go beyond 100.7 to start, because once it crosses 100.7, and as a mother, I understand my children much better. So if it is crossed 100.7, that means it is going to reach 103. And generally with my children, the paracetamol does not work so well. It does not bring the fever down. So from 103, it comes to 101 or something like that. But that's okay. 101 is something they maintain for 1 or 2 days, and then it starts coming down. I make sure that they hydrate well when they are in fever. Okay, very important is they have to hydrate, because these children will be sleeping for a longer period of time. So whenever they're, and don't force them to eat. Another thing which is very, very important, give them gastrointestinal break. Okay, the body is already fighting. So if the child demands that they want to eat something, just put some khichdi or the easily digestible food. Okay, don't tell them have juice beta, have milk also, have this also, have that also. You're not eating. Okay, let them not eat for 1 or 2 days. That's okay.
Yeah, hunger has never killed anybody.
Yes.
So, and second thing is, now from children, let me come to adults. If adults have a fever, say 101, 100, 101, what are the yoga exercises they can do? Is there any yoga exercises that can bring down fever?
There is no yoga exercises which can bring down fever. But if it is say 100, and then they don't do anything apart from resting. Okay, because the actually body needs rest. Huh? So right now, if they rest, that is good, because nowadays you have to tell adults also to rest. They don't know what is rest. They are so unrest. They'll be walking around. Acha, 100 fever ho gaya. Chalo isko niche laate hain. I'll have crocin and all that. Don't have anything. Just hydrate yourself and rest. But if it crosses, say, beyond 100 and coming to 101, then I would suggest that thoda sa na गीली पट्टी मम्मी वगैरह करती थी, गीली पट्टी लगाती थी सर पे, तो उससे क्या होता था, फीवर उस टाइम पे थोड़ा कम हो जाता था. And only if it starts crossing 101 is when you should think of taking crocin or dolo or paracetamol, whatever you are taking. That will take care. Okay, but don't get panicked. Many people get panicked with fever. Okay,
and it is normally said that if you take medicine, the cold will last for 7 days, and if you don't take it, it's for 1 week. It's almost the same.
Yes.
That's a saying that.
Yes, like so many people I know that as soon as they get cold, they take cetirizine, especially in Bangalore. Cetirizine is like one of the, or Monte Calci is one of the very, very favorite thing. I don't take, and people find it very, very strange that I don't take medicine. So, but for my immunity and my body, it works very well. And nobody understands your body much well than you. So you have to, and especially if you're trying to get out of, bad lifestyle and get into good lifestyle, you will face this. You will have cold, cough, fever and all that, because your toxins will get released. So you need to just rest and breathe.
And it is also said that taking hot soup when you have a cold is good. Is it just merely symptomatic, or does it really affect?
See, for example, tomato soup. Okay, now tomato is rich in vitamin C. So it will help your symptoms as well. Okay. So tomato soup is very, very soothing. For me, I always tell, and it's very easily digestible. It's very watery. So I always say that if you're down with cold and or hot rasam, in South, they prefer rasam a lot. And pepper and ginger. Actually, and if you're not, you don't like all these things, just in the water, have ginger and kali mirch, that is pepper, and just boil it nicely. Make it half decoction. So from say 1 liter water, it becomes half liter water, and then off the gas, and then put it hot and add little honey and drink that. I'm telling you that itself, if you drink once or twice in a day, will bring down your symptoms.
We have a question from one of our...
Tulsi leaf also, because Tulsi is a very good antiviral.
We have a question from one of our viewers. If I have cold, can I do Shirsasana?
Yeah, if I have cold, can I
do Shirsasana?
No, you should not. You should not. But yes, you can put the legs against the wall and lie down. That can be done, but not Shirsasana. No.
And is it right that taking amla and vitamin C or something? The vitamin C, of course, is the artificial form, but amla and lime is the form of vitamin C. What does it do? What is the relationship with cold?
See, amla and lemon both are very, very high source of vitamin C, and vitamin C improves your immunity. Okay, completely, directly. Okay, it's not that there is an indirect. Vitamin C will improve your immunity. I'm not a personal fan of amla, but I make sure that I include 1 or 2 amla every single day in my diet, because it's good for your skin, it's good for your hair, it's good for your immunity, it's good for every single thing. It's good for your heart, it's good for your lungs, it's good for your digestion. I'm telling you, you just see benefits of amla. Okay, you'll be shocked to see so many benefits. So I'm not saying that amla is like chamatkari fruit, but it is nothing less than chamatkari fruit. It is just a magical food, and you should include avla in your diet if you have not. And as I said, that many people find it difficult to have avla. So what I do is I take the avla, take out the seed and mix it in the mixie and make a paste of it and keep it in the glass jar, because it's vitamin C, right? You can't keep it in the other jar, plastic jar or anything. You have to keep it in the glass jar. Consume 2 spoons yourself and give it to the children, and then keep it in the fridge for the next 5 days. You can use it.
Yeah, and avla is also one of the biggest antioxidants.
Yes, rich in all. So you cannot think of anything else. If you ask, like many people ask me, what do you do for your skin and what do you do for your hair? I eat well. Eating well itself will take care of your skin health or hair health or any health.
Is there a special diet that one should follow during the monsoon?
Yes. As I said, you have to avoid a lot of raw food. Okay. If you're eating vegetable and especially fruits as raw, make sure you wash them thoroughly. Okay. Wash them, dry them, and then eat them. So just don't take from the shopkeeper and start eating. It is very important that you wash it during monsoon. Very, very important. More important. And not to have raw food outside your home, because you don't know what the kind of water, especially juices, what kind of water. Many people will see, they'll have idli till they will get stomach upset. It's not the idli which is causing the stomach upset, because idli was fermented and it was neither the sambar, it is the chutney, the raw chutney, which can cause the bacteria to breed. So it is very important that if you're eating raw food, then eat it at home, make it at home. Wash it properly and make it at home. So yes, I always tell that during monsoon, try to avoid raw food.
You had also mentioned about asthma, especially in Bangalore, because of the pollution and also what is known as the Congress grass, the pollen's coming out.
Yes.
Is it more during the monsoon or during the summer?
It's more during the monsoon and the winters. I mean, Bangalore winters are very mild, but it's from now on till Jan, it is a bad period for them. Generally. But it also again depends upon how much you are dependent on medicine, because to take out the body from a medicine body to a non-medicine body takes out a lot of effort, years of effort. Okay, so if you are used to taking Monte Calci or used to taking your pump, then it will take very, very long time to come out of it. And then nothing works. Pranayam won't work. It won't work. You have to, make your body little, like how I said, that 100-degree fever is okay. You have to understand that for everything, you can't be popping in medicine. Imagine if I have lived my life 8 years without popping a single medicine, everybody can. Okay. And I keep a track of what medicine I took, what. So the last time I took was antibiotic when my son was born, and that I had to take. So there are, the medicine is basically an emergency. Okay. I always say that if you have emergency, you need to take medicine. Okay. But non-emergency should not be catered with medicine. I completely disagree with that.
But people who have asthma should be careful while doing yoga. Some precautions.
100% they should be. And during asthmatic attack, they cannot do, because of course they are breathless, and where do they find the breath? They can use positions like simple, like if I put 2 pillows here and just be like this, of course I will find it easy to breathe. Okay. Or just leaning against the wall, I will find it easy to breathe. Okay. If I'm lying down on the bed, try to lie down not straight, because then I may find it difficult to breathe. Have 2-3 pillows and lie down slightly slanting, and I will find it easy to breathe. So yes, there are positioning which will help you ease out your breath. At that point of time, you can't do yoga or pranayama. The first thing about yoga is connecting with your breath. If you're not connecting with your breath, yoga is not happening.
Thank you very much, Dr. Pooja. Kishore was not able to join. I think he is doing the yoga exercises that you had told him to do last.
But you should tell Kishore that I missed him.
Yes, I will.
Love the way he asked the question, and especially I am a big fan of his Hindi.
Yes.
My Hindi, मतलब मेरी हिंदी अच्छी है एक्चुअली, मेरी हिंदी खराब नहीं है, पर साउथ में रह रहकर इतना अंग्रेजी भाषा का उपयोग करती हूँ कि हिंदी चला गया है सिस्टम से. तो वो मतलब कॉन्शियसली आई हैव टू मेक एन एफर्ट टू स्पीक हिंदी. तो मेरे को बहुत अच्छा लगता है जब किशोर जी हिंदी में मुझसे सवाल पूछते हैं.
Yeah, as they say in the north, especially when Dara Singh says it is Shuddh Ghee, he says a Shuddh Hindi. I think that is something that is. Thank you very much for joining us, Dr. Pooja. Wonderful the monsoon session that you said about exercises. It was wonderful having you. Thank you very much. Namaskar.
Thank you.
We now have the session intro video. Welcome back. Health4All is live now on Facebook and YouTube. We now move on to our fortnightly episode called Technovision, which deals with the healthy marriage between new technologies and health, a very interesting growing field. This episode will be dealing with the role of new technologies and artificial intelligence in pulmonary health. And we have with us Dr. Sampath Nagar, who is the Chief Medical Officer and Health Officer at Baran District in Rajasthan. He'll be joining us very soon. We also have with us Mr. Naresh Hasija, who is the Vice President of Viatris, a global healthcare company. As a public health specialist, he has held leadership positions and worked with brands like Viatris, Mylan, Biocon, Dr. Reddy's, and MSD. He has worked in a variety of domains, including public health, oncology, infectious diseases, gastroenterology, metabolic disorders, immunology, nephrology, and family planning and healthcare. Before welcome Mr. Naresh, I think when Sampath joins, I'll go ahead for his questions. My first question to you is, how can large pharma companies do in digital transformation, and what are the technologies that would play a key role in this field?
Thank you, Shankar. I will just say good morning to everybody. Though it's a Sunday morning, Dr. Sampath has also joined. So to answer your question, today I feel like from last 2-3 years, we've been debating on this matter. All pharma companies now should behave like a healthcare company. They should not be only producing pills, injections. They should start behaving as a comprehensive healthcare company. They should start looking into integrated disease management, where whatever disease area we all pharma companies are working. For example, for us, infectious disease is a key priority. In infectious disease, whatever it takes to manage the whole disease, whole patient journey, I think we wanted to get involved. This is one reason and one expectation we have with pharma industry now going forward. Like for us, we have moved forward in this space. What we have done is to manage infectious disease, not only private health, but also the public health. What we have done is we have started exploring areas like using AI for disease identification, using telemedicine and e-health for providing the best possible services at bottom of pyramid. And all this can be done in future, which we haven't explored yet, is by using wearable devices. Right now in private market, you, me, and a lot of people we have started using wearable devices. So this will become a key measurable point, maybe in future in public health. So this is one space where we have gone in depth and started working so that we can provide a lot of better solutions to the patients. Thank you, Shankar. Over to you.
Yeah, I will come back to you, Mr. Naresh. I'll go to Dr. Sampath. Dr. Sampath, welcome and good morning.
Good morning, sir.
Yeah, welcome to the show. And I start with 2 questions to you.
Yes,
what is the role of AI in pulmonary health, number 1? And number 2, you have been using AI in detecting issues in lungs. Can you explain your work? So first, what is the role of AI in pulmonary health?
Sir, AI is the wonderful work in diagnosis of the pulmonary tuberculosis, because of very few pulmonary specialists and radiologists in our district Baran, so that in any type of X-ray is doing at our district hospital regarding to MLC purpose, regarding to physician purpose, regarding to surgical purpose. When the X-ray is done at the our lab X-ray department, AI suspected this patient may be tubercular or not. Near about 4,000 X-ray done at our district hospital. Out of that, only 900 X-ray patient is follow for the sputum and CBNAT, and near about 40% found positive. So that due to deficiency of the pulmonary physicians and radiologists, this is the wonderful work in tribal belt, because we have no experienced person, no specialist person in field.
And how early has AI detected, say, issues like lesions in the lungs or tuberculosis? Is it earlier?
It is earlier, sir, because when a patient come to physician, pulmonary physician or chest physician in any problem regarding to TB, first of all, we doing the X-ray, then sputum examination. Next on, we also call for confirmation, so that that takes about 4 to 5 days. That's why in the AI first day, we can detect or suspect that this patient is pulmonary tuberculosis or not. So there is the reducing the time 4 to 5 days to 1 to 2 days.
So what is the accuracy assay? Is it better than what radiologists try to find, or is it same or much better?
Sir, we analysis the data of the Baran district because of we are lacking AI detect more about 4,000 persons, but we confirm only for 97. There is the lacking in the follow-up at our site, so that we can conclude the data. What is the specificity and what is the sensitivity of the AI? If we calculate all the data 4,000, then we can clearly say that the AI is better or that's radiology is better. So there is the gap, sir.
Yeah. Now you said that you extensively use this in Baran district and in tribal belts. Now, one of the biggest problems that we had during COVID was that you didn't have enough radiologists, enough doctors to detection, and also coronavirus affected the lungs first. So did you use this during the COVID period to detect early onset of the virus?
Yes, sir. We continuously use during COVID, and we detect mostly patient from AI.
So there is a big use that has been done during COVID.
Yes, sir. And we need more extensive role. We also want to the AI installation in our tribal belt, Sabat, Kishanganj blocks. So in rural area, because there is the prevalence of the tuberculosis more than other blocks. 2 blocks we are Seria community tribal belt. There is lack of the poor condition of socioeconomic, lack of health hygiene. There is a many percent. So we need that 2 blocks also.
So do you use AI only for the lungs, or do you use AI for detecting other area diseases also? Especially you have tumors and other things, and also is it only used for lungs right now?
Sir, we only use for lungs disease.
And how many, apart from in Baran, how many machines have you deployed in AI in detecting, say, issues concerning the lungs?
How many?
How many of these AI tools are used in your district? Is it only in the district hospital, or
only one tool at district hospital, sir?
So the patients will have to come to the district hospital, and it is there where you detect this.
Yeah, sir.
So it is a very easy technology. So can this be spread towards the primary healthcare centers also, where you don't have radiologists?
Yes, sir. We want to spread this technology at least our CSC. If not possible, that PSC, because maximum patient outload at CSC level. So we want to extend the IA installation technology at CSC level, especially Kishanganj, Sabat, Kelwada, at least 3-4 CSC at a Baran district.
What are the major lung issues that you face in your district?
Sir, mainly, sir, tuberculosis is also prevalent in Baran, Kishanganj, Sabat, near about 2,000 persons per year diagnosed as a new cases of TB. And second is the COPD, because of the addiction of the tobacco, smoking is also the very big issue in tribal belt.
Yeah, and I just want to tell you that this particular AI in detecting, you have been, of course, using in lungs, but I think in Bombay Municipal Corporation, they have been using it extensively for detecting tumors and other areas. And they did a wonderful job during COVID, as what you have done in Baran district. So I'll come back to you, Dr. Sampath. I'll just have one more question for Mr. Naresh, and then I'll come back to you. Mr. Naresh, we are actually in the threshold of, a big revolution so far as the AI machine learning is concerned. So in pharmaceutical industries, how do you see the future in probably the next 10 years where AI and machine learning are supposed to make a big mark?
So I see that, as I was discussing, I think now a lot of pharmaceutical companies are trying to be a full disease integrated companies. So in that space, maybe 10 years down the line, I assume and I feel we all should be moving from now sick care to a healthcare, a true healthcare. So in this case, I think preventive space will take up preventive care will take up a lot of space. and this will become so important. Today, if you see our Prime Minister who is driving from last 5 years, there should be a big space given to preventive care. So we all are moving to the direction. I think COVID has given a lot of learnings. Now I was attending your program where I see that a pharmaceutical company is running a large show from so many months for preventive care. So we want like people to take up these steps. So we see that future is going to the direction, and the way vaccination invention is happening, the way I assume whatever, there will not be only this pandemic, there will be a lot more coming in the future. I think the way drug development is happening, AI and machine learning is going to play a big role there. And in drug development will not take now the same time, which used to like 40-50 years to funnel down a particular molecule. So this will happen faster because we will utilize our past learning through machine learning and AI and come out faster to the target of invention. So if you see back-end point of view, there will be a faster invention. A lot of companies will promote a lot of medical devices, a lot of medtech, a lot of vaccines, which will come into play. And if you see patient point of view, we will be moving away from sick care to a good health care, where like we all will behave a good expert, good people taking care of our health. Over to you.
So you said that AI can play a major role in developing drugs faster, or finding active molecules faster than the traditional method. So can you just briefly tell us how faster can this be done? What is the normal course for as of now, and how much can AI reduce?
So I have a very, very good example where like tuberculosis, a highly deliberating disease, which took 40 years for a new molecule to bring it for the treatment. The vacuum was huge. It took almost 40 years. So I'm assuming there are 40 to 50 years. Similarly, when you see cancer, you see newer molecules coming up with an increment of 5 to 10% better efficacy or better quality of life, or maybe 10% delayed in disease progression for cancer. So 40 to 50 years almost it is taking right now. What I'm assuming scientists across the world, maybe in all the best universities, what they're trying to do is right now they are trying to bring all this experience together and trying to use AI and ML in such a way so that if there are 100 targets they have identified, and if we used to take 10 years to come down to 10 targets, now I think we will take few months to come to those targets. And we can funnel down faster, and the innovation can happen faster. And then I think the preclinical, clinical phase, which remains normal, I think that will take the place, and drugs will be in the market little earlier.
So you spoke of 10 years down the lines for pharmaceutical industry. So far as AI is concerned, do you see AI being increasingly used in predictive medicine or curative medicine?
So very good question. Right now, what I see is AI role is particularly in diagnosis. I see a major role they're playing for, as Dr. Sampad also rightly said, for lung diseases. X-rays are playing a major role. Now I think there is a good development happening for CT scan, for MRIs. AI is coming up in a big way. And I recently heard companies are pitching in for stroke. So in our country, I think stroke identification takes time because of the availability of resources right now. So if this can be done on the spot by using AI, I think this will help us to save some more lives and will surely augment the efforts of government to save lives.
Thank you. I'll come back to you, Mr. Naresh. Over to you, Dr. Sampath. Dr. Sampath, are you available?
Yes, sir.
Dr. Sampath, the Central TB Division has recently asked districts to screen 3,500 presumptive suspects for every 1 lakh population. With the goal of TB elimination by 2025, do you see an increasing role of AI in screening and detecting TB cases?
Yes, sir. Many undiagnosed and unnoticed cases in the community is there. If increasing the AI at CSA and PSC level, sure, we definitely increase the notification of cases and timely we start the early treatment of that patient. So community spread of the TB control is very effective, and we achieve our target at 2025.
So you have done wonderful work in Baran district in Rajasthan. Now, what is now the next step that you want or your wish how AI can be used in other fields in your district?
Sir, we need in the field of the cardiac sector, because our district population is around 14 lakhs, and we have no facility at PSC level of ECG and any other cardiac investigations. So if it is possible to AI in the field of the cardiac MI, brain stroke and any related to cardiac investigation, it is the wonderful role in the saving the lives of the cardiac disease.
So what is the incidence of cardiac problem in Baran district? Do you have more of cardiac problems, or do you have more?
Near about average in district 2-3% of the cardiac problems, coronary artery disease is reported in district hospital. That is the diagnosed cases, and undiagnosed cases at the PSC CSC level we have no data for that. But in the field of the cardiac, we because we have only the six physicians at our district on the population of the 14 lakhs. So that is the very big problem, and routinely we hear about 1-2 deaths of the cardiac arrest, suddenly cardiac arrest of the young people also.
Has this increased during the COVID period?
Yes, sir. We find that after the COVID, the cardiac patients, acute cardiac arrest patient is increasing.
Yeah, actually, AI has been increasingly being used in cardiac, stroke, and cancer. These are the fields where they have. In fact, in the last session, which you will be seeing now after this particular session, is that a pioneering work being done to detect early onset of breast cancer using AI too. I think that was a very innovative way of using artificial intelligence. Now, I'll end this session with a common question to Mr. Naresh and also to Dr. Sampath. How do you see, what is the future of IA in Medicare? Mr. Naresh, to start with you, and Dr. Sampath to you later.
So you said AI's future in medicine.
Yeah.
So
in medicine and pharmaceutical, both, any healthcare in general.
So in a very simple way, I'll just take up this, Mr. Shankar. So if you remember our old days when we used to go to doctors, doctor used to see our pulse, or maybe there were doctors who used to, by seeing us, used to tell us what disease you have probably, and then I think they used to start on us on empiric treatment. But I see AI in the same synergy, where a machine is learning by practicing same situation or of a particular disease multiple times. So, for example, in this situation, when you see that machine has gone through 50 lakh X-rays, so that machine knows that if in an X-ray, this particular spot is there, this is for what? So that machine has been taught in such a way, it has started predicting. So maybe in day one, it was not the same. When they would have read 10 lakh X-rays, they would have been doing mistakes. They would have been doing 30% accuracy, 40% accuracy. Now, after reading so much X-rays, they have reached to a level of 95% accuracy, which normally we don't see with the humankind. So if you ask me, I overall see a very, very good scope of AI helping us, helping humankind to predict things better, to move things faster. And overall, if you imagine, there are thousands of road accidents which happens across the world. And if we can identify stroke on the spot and start the treatment early, I think we can save a lot of lives. So I see a lot of scope of AI in healthcare delivery system, healthcare innovation, pharmaceutical innovation. I see a lot of scope going forward. And next, which is becoming very, very popular these days, is now you are talking to a machine. When for example, you just, there are a lot of apps which are helping patients in India, where you tell them about your particular symptoms, and they are telling you, maybe with these symptoms you may have this disease, and then they are taking you to the confirmatory according to specialty. For example, if I have a problem around gastro, my symptoms are sounding like a gastro problem, AI is taking me to a gastroenterologist. So we are saving a lot of time for our healthcare professionals and bringing healthcare delivery faster. So I see lot many use are going to come in the future.
That's wonderful. So we're on the threshold of an exciting era, and as what you said, 95% is quite a huge number of early detection of cases. I think that's wonderful. Now, Dr. Sampath, apart from the wonderful work you have been doing in Baran district, what do you see the future of AI, and where do you like AI to reach, especially in Baran district and tribal areas? So what is the future of AI so far as you are concerned?
Sir, in my concern, the AI is definitely helpful for us, the improvement of the primary health care in socio-economical lower classes of people at that's village site also. Can we, in future, we will use it mobile medical units at village level also, so that we can use for strengthen the primary health care. So also it is the cost effective and less time consuming. So we have a lot of benefits at primary healthcare center.
That's wonderful. I think that gives a big impetus to India's healthcare program. And as you said, it is not only patient friendly, but also it is quite cheap in the sense that it is affordable also for people in various districts. But I really wish that it becomes more mobile and you're able to spread this technology across in remote areas of various districts in India. Thank you very much for being with us. It was wonderful hearing of your wonderful work in Baran. And thank you, Mr. Naresh, also. I think wonderful session that we had. We now have a small video on the role of technology so far as a Technovision, which we had in the last session. And I request my admin to play this particular session, a particular video on the role of AI especially in breast cancer detection. Over to you, admin. Please play the video. The topic in this episode is artificial intelligence, a pleasant present to healthcare. And to discuss on this, we have with us Dr. Geeta Manjunath, the founder, CEO, and CTO of Niramai Health Analytics, and has led the company to developing a breakthrough AI solution for detecting early stage breast cancer in a non-invasive, radiation-free manner. She comes with over 25 years of experience in IT innovation. Before starting Niramai, Geeta was the lab director for data analytics research at Xerox India. She has received many international and national recognition for her innovations and entrepreneurial work. She's also an inventor of 16 US patents and more pending grants. The next speaker is Dr. Anuj Kumar Bharti, an assistant professor at Bennett University and a PhD from the Indian Institute of Technology, Jodhpur, and he did his work in the emerging area of cognitive science under the Department of Electrical Engineering. He also gained his experience in designing and conducting fMRI experiments at the Institute of Nuclear Medicine and Allied Sciences, New Delhi. His focus is to study neural regions contributing to the feature binding process through imaging, developing automated solutions. I am Shankar, President of Health Foundation, and I will be moderating this session. Can you briefly explain what actually is artificial intelligence and how is artificial intelligence used for detecting early stage breast cancer in a non-invasive, radiation-free manner?
So what artificial intelligence is, the field of science, computer science, where using mathematics to model this function of learning patterns, right? So that's roughly how we would say. And also AI is now changing the way things are done in almost all fields. And we are here to talk about how healthcare is being modified. And particularly talking about, AI in medical imaging. You would have, many of us would have seen these images, and there are also brain, and I think our next speaker is going to talk about the brain and MRI related aspects of it. What I want to sort of, focus on is radiology in general, where you use these machines to actually look into the body, because you cannot actually, if you want to know whether somebody has cancer, you cannot actually poke every bit of the skin. Obviously you need to know where is a likely lesion, where is a likely tumor, and then you can do a tissue test at that particular location, right? And so in order to look into the body, we have different types of imaging methodologies, right? And so it could be, MRI, it could be X-ray, it could be ultrasound, it could be an infrared ultrasound, and so on, right? Many methods. But so all of these machines you're seeing are these imaging devices, and use of AI will help in identifying the likely location, right? I mentioned briefly. So this is usually and traditionally done by expert radiologists who are trained to look for abnormalities in images. But what happens when you're looking for early detection? Because early detection is very, very important to save lives. When you do early detection, you're actually screening and imaging almost everyone in a preventive manner. When you're trying to do that, there's huge lot of data or images and tasks, right? Interpretation tasks. The radiologists, becomes a shortage of expert radiologists, because there are only about 18,000 radiologists in the whole of India, for example, right? So this enhanced productivity of the radiologists is very much needed in order to have faster diagnosis, better diagnosis, reduce errors in diagnosis, and overall increasing the patient outcome of detecting, abnormalities early. And as I mentioned, AI really loves pattern recognition. It does very well. And that's why it's a good synergy between the benefit that AI can provide to healthcare and what radiology needs. And then one of the primary areas where AI is used in healthcare is in radiology. And I'm going to talk about briefly, for 5 minutes or 10 minutes, about how AI is used in breast cancer diagnosis. And a quick statistics: it is one of the largest cancer killers in women. 680,000 women died in 2020 because of this disease, and almost 90% of them could have been saved. Yes, it is possible to save lives if we can detect cancer early. Particularly breast cancer is the most manageable of all the cancers, and early detection is very, very important. And if you look at why early detection is not happening, there are several gaps today. Mammography, which is the standard for breast cancer, has some issues, such as there's a concept called dense breast, especially for women under 45 years of age. The X-ray of the breast, which is basically the mammogram is an X-ray, it looks something like this. The whole breast appears white, and how do you find a lesion which is hard stuff, which is a white spot in this? It becomes very, very difficult, and so many women get unnoticed for their breast cancer early. And so they really detect when they're able to feel it as a lump, and that's already stage 3. And how do we enable early stage breast cancer detection? And that is a question that is not yet answered so far, right? And then it's not just women under 45 years of age, even women above 45 have dense breasts, almost 50% of them. And even in those cases, mammography is not effective. And then, of course, there's affordability and accessibility issue for many imaging modalities, and shortage of radiologists, which also increases the cost of screening. And then also because use of X-rays is not really the best method of, detecting cancer, because every screening is actually increasing the cancer risk for the lady, which is crazy, right? So with all this, what's happening is only 10 or 7% of women are actually going through preventive screening in the whole world, and it's less than 2% in India. So how do we change this? And that's where, we as AI experts, we wanted to see whether we can make a difference, right? And then we looked at mammography. Of course, there are several works on use of AI on mammography to improve or make it faster for analysis. But the concept and the issue of dense breast still remains. Irrespective of how much of AI you do, it's always looking at X-rays of dense breast. So we came up with a new method called thermalytics, where we just measure the temperature variations on the chest. We create a thermal image, which is basically a map of the temperature of the different tissues. And so you get an image of like this, where every picture, every dot is signifying the temperature. Now, using just this to visual analysis is not, it's very subjective, not accurate. So we actually developed an AI on these thermal images to have a very new method of detecting breast cancer, which can detect much before a lump is felt. All one needs to do is, this is a small device, very portable device. She just sits in front of the device for 10 minutes and she comes out, her report will be ready. And nobody would have touched her. There is no contact, nobody would have even seen her without clothes. And it's like a changing room experience. She just gets in, she closes the door, she sits in front of the device and she comes out, the report will be ready. And the report is generated by the artificial intelligence algorithms that we have developed over these thermal images. And it does work for women of all ages, and it's more affordable and all that.
Dr. Geeta, will thermal imaging replace mammography, and can this be used for population-based screening?
It has already replaced mammography in many hospitals and diagnostic centers where mammography is not affordable, because a mammo machine costs 80 lakh rupees, and how many small diagnostic centers can afford it? Having said that, in developed world where mammography is fully standardized, it's available available for the last 30 years. Everyone is doing it as free. The government is providing it as a free service. It will take time to replace, but I would say it can still be adjunct or an additional supplemental method for mammography in countries like US, in US and countries in Europe, where we have approval as well, where it will be used for screening younger women and women under 45. However, in countries like India, Philippines, Indonesia, Africa, many other places, right, it is being currently used instead of mammography, because it does have better accuracy than mammography.
Now, speaking of mammography, it is still there, but there is an issue here that it is less sensitive in women with extremely dense breast tissues than fatty breast tissues. And women with extremely dense breasts are 3 to 6 times more likely to develop breast cancer than women with almost entirely fatty breasts, and 2 times more likely than the average woman. Can artificial intelligence help out in such cases through supplemental MRI?
Yeah, so it depends on the country. Yes, absolutely, dense breast is an issue, and that is where I was mentioning about thermalytic solution, which is definitely a solution for dense breast women. We have done several studies on dense breast to show how the accuracy of this is much better than mammography. Using supplemental breast MRI is definitely one option, but I think people who have seen the MRI machine, right? It's a huge machine. People have to go. It cannot be used for screening at all, right? Typically what is recommended is for high risk women who have maybe a family cancer history, who already have a BRCA positive gene mutation. Then we have a case for doing breast MRI on the lady, because many times it has to be contrast enhanced and it is not great for the body, right? So what is generally recommended, and this is where at least in India it is getting standardized, more than 50,000 women have gone through and 100 plus locations, is to do thermalytics for screening and And then for positive patients, then you take them through a diagnostic workup, which can include breast MRI in addition to an ultrasound, for example, right? So that would be the best method. Yes, I think somewhere you asked me whether it can be used for population screening. Yes, thermolytics can definitely be used for population screening, as well as preventive care in diagnostics and diagnostic centers and hospital. For example, almost 150 centers today in 25 cities have this test inside the hospital. Of course, we have done several camps as well, because it's a portable, non-radiation based test which can be set up anywhere. In fact, we've also started home screening with this, because many women cannot even come out of the home because of COVID, and at least it was becoming better, but again you're seeing the next wave coming up. So this home screening is also something that people have availed, which is possible because it is radiation free. Otherwise it is not. You can't do it anytime, anywhere. Yeah.
Can you explain to our viewers what exactly is functional MRI?
Functional MRI, generally we talk about whenever MRI or any imaging. So we take a structural information which is residing inside the body. For example, if you are taking a structural MRI, it will show you which brain area lies where, just like. Functional MRI is a method when we take the live scanning of the brain and we can check, like if the person is doing the memory task, so which of the brain area is consuming the oxygen at that time. So functional MRI is a dynamic MRI which gives you the dynamic activations inside the brain related to a particular cognitive or psychological process.
The human brain is one of the most complex and fascinating organ. And your focus is to study neural regions.
Yes.
Can a combination probably of, since you are doing this, can a combination of combination of artificial intelligence and brain scanning technology help doctors in reducing or removing specific fears from the brain, increasing self-confidence, and even alter personal preferences?
Personal preferences, yes, actually. So whenever we are doing the fMRI and we can apply the artificial intelligence over a particular set of people, we can get the neural regions related to that particular cognitive process. So depending on the brain regions we are getting, we can give the certain practices which can alter the idea behind the particular cognitive process, which is you're talking about the personal preferences. Yes, we can do that.
Yeah, you were speaking about, fMRI can measure the brain activity by detecting changes associated with oxygen levels and blood flow.
Yeah.
And this is used to predict types of brain disorders.
Yes, it is used, and it is vastly used all over the world these days. And the people also using artificial intelligence to develop the early detection of neurological or psychological disorders. But for example, if you are talking about Alzheimer's or Parkinson's, so we can get the details whether the hippocampus or the frontal cortex is normally responding in a particular memory task or not. So we are also in a stage to develop the cognitive biomarker for these serious diseases. If we talk about the Alzheimer's, there are memory and perception tasks. So there are perception processes. For example, if I talk about my work, so I am working on the feature winding, which is validated in Europe to be considered as the cognitive biomarker of Alzheimer's. So if we can detect the deterioration in feature binding at an early stage, so we can predict whether the person is going to be have Alzheimer's in the later stage or not. So yeah, we can detect that.
How early can you predict?
How at the adult age, yeah, before the mild cognitive impairment.
Welcome back. So that was actually a peep into the future of AI, how artificial intelligence is being used for detecting breast cancer and also early detection of diseases of the brain, especially Alzheimer's, schizophrenia, dementia, and other things that can be detected well in advance based on the patterns that built up by the AI. I think this was a wonderful session. We had excellent speakers. We had wonderful work showcased by Dr. Sampath. We also had Mr. Naresh along with us. And thank you very much for sharing your time with us. Thank you. And we end this Technovation here. Thank you, sir.
Thank you. Thank you, sir. Thank you, sir.
Thank you. Thank you very much.
We now move on from here to Health Nama, which is a capsule put together by my co-host Kishore Malviya. And this time, the topic is thalassemia and iron deficiency. So over to Health Nama.
नमस्कार। हेल्थ नामा में आज हम 2 विषयों पर बात करेंगे। एक थैलेसीमिया बीमारी पर और दूसरा शरीर में आयरन की कमी पर। थैलेसीमिया एक समय हमारे देश में रेयर डिजीज़ मानी जाती थी, लेकिन अब हर साल इसके इतने मरीज आने लगे हैं कि अब यह डिजीज़ की श्रेणी में नहीं आता है। हमने विशेषज्ञों से जानने की कोशिश की है कि आखिर ये बीमारी किसे और क्यों होता है, इससे बचाव का तरीका क्या है, और ब्लड ट्रांसफ्यूज़न या बोन मैरो ट्रांसप्लांट क्या हर मामले में ज़रूरी होता है। इसके अलावा हमने डाइट एक्सपर्ट से ये जानने की कोशिश की है कि अगर शरीर में आयरन डिफिशियंसी हो तो क्या होता है और क्या करना चाहिए, क्या नहीं करना चाहिए, क्या खाना चाहिए, क्या नहीं करना चाहिए, क्या इससे बीमारी होती है। प्रस्तुत है विशेषज्ञों से बातचीत के प्रमुख अंश।
एक मरीज को कब और कैसे पता चलता है कि वो थैलेसीमिया से पीड़ित है? मेरा कहने का मतलब है कि शुरुआती लक्षण क्या है इसके?
तो थैलेसीमिया का पता ऐसा चल सकता है कि कभी किसी बच्चे को बॉर्न होने के 2-3 महीने के अंदर बुखार हो गया, या फिर उल्टियाँ आ रही है, या खाना नहीं खा रहा, क्योंकि हीमोग्लोबिन कम होने से जो भी सिम्टम्स हो सकते हैं वो सब उस बच्चे में दिख सकते हैं। बुखार होना, इन्फेक्शन का जल्दी कैच कर लेना, या उल्टियाँ होना, खाना नहीं खाना, बहुत ज्यादा सोना, पीला पीला रहना, लाल हो जाते हैं बच्चे, लाल नहीं होते ये वाले थैलेसीमिया से पीड़ित क्योंकि खून की कमी है। तो ऐसी चीजों के बाद अगर आप एक डॉक्टर के पास जाते हैं तो डॉक्टर आपको टेस्ट बताते हैं जिसमें थैलेसीमिया का पता चलता है।
थैलेसीमिया एक रेयर डिजीज है, लेकिन इस पर काम भी लगता है रेयर ही हुआ है, क्योंकि मुझे नहीं याद है कि बहुत ज्यादा सरकारी योजनाएं हैं इस पर, जैसे अन्य बीमारियों पर है। आपको क्या लगता है, कोई सरकारी योजना है और कितनी कारगर अगर है तो?
जैसा कि आपने कहा कि थैलेसीमिया एक रेयर डिसऑर्डर है, लेकिन मैं इस बात पे पॉइंट आउट करना चाहूंगी कि रेयर में भी ये रेयर नहीं है, बहुत से, मतलब इंडिया, एक शर्म की बात है कि इंडिया थैलेसीमिया कैपिटल है वर्ल्ड का। हर साल 10,000 से ज़्यादा बच्चे थैलेसीमिया से पीड़ित पैदा होते हैं इंडिया में। तो इसको रेयर कहना एक सही शब्द नहीं होगा, क्योंकि अब ये रेयर रहा नहीं। लेकिन जैसा कि आपने कहा कि जी हाँ, कुछ सरकारी योजनाएं की कमी सी महसूस होती है, ज़्यादा काम नहीं हो रहा है, इसीलिए शायद ये अब रेयर रहा नहीं है थैलेसीमिया। कुछ हाल ही में 2016 में जो RPWD रिफॉर्म होके आया सामने, उसमें थैलेसीमिया को इंक्लूड किया गया, जिसके लिए हम लोग बहुत खुश हुए। हमने बहुत चर्चा भी की इस बात पे, पर कई जगहों पे फिर हमको भूल गए। जब बात एम्प्लॉयमेंट की आती है तो थैलेसीमिया को छोड़ दिया गया RPWD में। आयुष्मान भारत में भी थैलेसीमिया का बहुत ज़्यादा जिक्र नहीं है। तो जहाँ कवरेज की बात आती है, चाहे वो इंश्योरेंस हो या सरकारी योजनाएं हो, अम्ब्रेला टर्म के तहत थैलेसीमिया कवर्ड है, लेकिन रूट रियलिटी में थैलेसीमिया छूट जाता है।
हीमोग्लोबिन की कमी या एबनॉर्मल हीमोग्लोबिन तो और भी कई बीमारियों में, जैसे एनीमिया में भी होता है, कई बीमारियों में होता है। तो लोग कैसे फर्क करें कि ये थैलेसीमिया है और या एनीमिया है, या कैसे पता करें?
कोई भी जैसे एनीमिया होगा तो उसके मुख्य लक्षण यही होते हैं कि शरीर जो होता है, चेहरा आपका पीला पड़ जाता है, आंखें पीली पड़ जाती हैं, बच्चे को बहुत नींद आने लगेगी और लेथार्जिक आप फील करोगे, थकान फील करोगे, ऑक्सीजन की मात्रा आपके शरीर में कम हो जाएगी। उसके बाद जो आप सीबीसी, पहला सिंपल टेस्ट होता है सीबीसी, वो आप जब कराएंगे तो आपको हीमोग्लोबिन के पैरामीटर्स मिल जाएंगे। फिर उसमें आपके जो आगे के पैरामीटर्स है RDW वगैरह भी अगर अबनॉर्मल आते हैं तो हमारा सेकेंड स्टेप होता है कि हम थैलेसीमिया स्क्रीनिंग टेस्ट के लिए भेजते हैं बच्चे को। फिर जब उसका भी अगर पैरामीटर्स अबनॉर्मल है तो उनके पेरेंट्स का हम जेनेटिक थैलेसीमिया स्क्रीनिंग करते हैं, और अगर पेरेंट्स यानी मदर और फादर दोनों अगर माइनर हों तो उनका होने वाला बच्चा मेजर होता है। सो वहां से हम पता करते हैं कि जो बच्चा है वो थैलेसीमिया मेजर है और उसका हीमोग्लोबिन अगर कम है तो उसे आजीवन फिर रक्त देना पड़ेगा।
और बोन मैरो ट्रांसप्लांट की जरूरत कब पड़ती है?
बोन मैरो ट्रांसप्लांट जनरली जो रिसर्च है अब तो वो 20-21 साल के बच्चों तक के लिए भी करता है, बट पहले जब छोटी एज होती थी, जैसे कि बच्चा पैदा हो गया, जब उसकी इम्यूनिटी डेवलप हो जाती है 7-8 महीने में या मेजरली 1 ईयर, उसमें आप पेरेंट के साथ 3 टाइप के बोन मैरोज होते हैं आजकल। एक होता है सिबलिंग के साथ, भाई बहन के साथ, दूसरा होता है हैप्लो जो पेरेंट्स के द्वारा बोन मैरो लिया जाता है, और तीसरा होता है मड डोनर। मड डोनर यानी कि आप बाहर किसी डोनर के पास में आपका बोन मैरो मिलेगा, जिसको हम लोग मड डोनर कहते हैं। जनरली इंडियंस के साथ जर्मन डोनर का बोन मैरो मैच होता है। तो जब लगता है कि अगर आपका डोनर मिल रहा है और आपका 100% मैच है, तभी कोई भी पेरेंट्स बोन मैरो के लिए जाता है, क्योंकि बोन मैरो एक रिस्क भी होता है कि जनरली जैसे फेलियर होने के चांसेस भी होते हैं बोन मैरो में, इसीलिए उसका मैच होना बहुत आवश्यक है। सो अगर मैच है, डॉक्टर को सारे पैरामीटर्स पॉजिटिव लगते हैं पेशेंट के, जैसे हालत बोलिए, जैसे बहुत ज्यादा स्प्लीन इनलार्ज नहीं है, या बच्चे का हीमोग्लोबिन हमेशा मेंटेन्ड है और बच्चे का ग्रोथ मेंटेन्ड है, तो वो सारे पेशेंट्स एलिजिबल होते हैं फॉर बोन मैरो ट्रांसप्लांटेशन।
हमें कुछ एग्जांपल्स बताइए जिसको खाने से आरबीसी तो बढ़े लेकिन आयरन ना बढ़े।
जैसे मैंने आपको हीम और नॉन हीम आयरन बताया, आरबीसी जैसे मैंने आपको पहले ही क्वेश्चन में बताया है कि आरबीसी बढ़ाने के लिए जैसे कि आयरन कहाँ पाते हैं, आरबीसी है हीमोग्लोबिन हमारा आयरन कहाँ रहता है। कोई मैस को खा करके आपका आरबीसी बढ़ेगा और आयरन नहीं होगा। ये बैलेंस में हमें खाने की जरूरत है। जो सोर्सेस होती है वो उस पर्टिकुलर पर्सन के सोर्सेस में बता रही हूँ। जैसे ग्रीन लीफी वेजिटेबल्स है, आयरन के सोर्सेस है, वो हम सारे खा रहे हैं। जैसे एक हम पुदीने या धनिया पत्ती की चटनी बोल रहे हैं, साथ में नींबू लेमन स्क्वीज किया, ये सारी चीजें विटामिन सी के साथ में डाले कि हमारा एब्जॉर्प्शन भी हो और स्लोली एंड ग्रेजुअली वो बढ़े। साथ में है सिर्फ आरबीसी कम नहीं होता है, प्लेटलेट्स भी कम होते हैं। जैसे कीवी है, फ्रूट है, विटामिन सी से रिच फूड है, टोफू सोयाबीन के प्रोडक्ट है, हम नट्स खाते हैं तो नट्स में भी सारे नट्स नहीं है, जैसे थोड़े से कैश्यू खाएं। क्वांटिटी को लिमिट रखना है ताकि हमें बेसिक आयरन हमारे बॉडी में कितना है। ऐसे जब एक डाइटिशियन कोई भी डाइट या सोर्सेस को बताते हैं, किशोर जी, ये जो एक नॉर्मल मिथ है कि एक जनरल डाइट सभी को लगेगा, वो नहीं होता है। उनका लेवल क्या है, उनकी आयरन की का लेवल क्या है, उनका आरबीसी का लेवल क्या है, उसके अकॉर्डिंग वो वेजिटेरियन है, नॉन वेजिटेरियन है, उनके सोर्सेस क्या है, वो कितना ले सकते हैं, उसके ऊपर ये सारी डिसीजन हम लेते हैं कि उनको क्या प्रोवाइड करना है। जनरली जो आयरन सोर्सेस हैं और साथ में विटामिन सी रिच फूड है, उनको खाएंगे तो फिर हमारा आरबीसी का लेवल बढ़ेगा। और ऑब्वियसली मेडिसिन तो साथ में लेनी ही पड़ेगी आयरन चिलेशन के लिए।
देखा गया कि प्रेगनेंसी में आयरन की कमी महिलाओं में आम है।
हाँ।
एक प्रेग्नेंट महिला के लिए क्या डाइट प्लान होना चाहिए?
एक प्रेग्नेंट महिला के लिए जो है ये सारे न्यूट्रिएंट्स बहुत इंपॉर्टेंट है। इनफैक्ट गवर्नमेंट ऑफ इंडिया ने जो है अब आयरन, विटामिन सी, फोलिक एसिड, इन 3 चीजों को तो कंपल्शन कर ही दिया है। तो इनको बिसाइड्स द डाइट इनका सप्लीमेंटेशन भी जो है ये कंपल्सरी किया है, क्योंकि पहले देखा गया था कि, और ये एक्चुअली मेरा खुद का एक प्रोजेक्ट भी हमने किया था बॉम्बे में, इट वाज अ मल्टी स्टेक होल्डर प्रोग्राम, कि जो हम विमेन को देखते हैं इनका हीमोग्लोबिन लेवल जो होता है 6, 7, 8 इवन व्हेन दे आर प्रेग्नेंट, तो जो चांसेस ऑफ मिसकैरेज होते हैं ये काफी हाई होते हैं। इसीलिए अगर हम तभी से, इनफैक्ट प्लानिंग फॉर फोलिक एसिड एंड आयरन शुड बी डन बिफोर प्रेगनेंसी, राइट। तो इसका जो जर्नी है इसको हम जैसे ही टीनेजर हो या किसी की शादी हो एंड यू आर प्लानिंग अ प्रेगनेंसी ओवर द नेक्स्ट 1 year 2 years, you should start preparing your body, because folic acid also is required for the healthy spine। तो स्पाइनल बिफिडा जो बोलते हैं, अगर फोलिक एसिड कम है या मेंटल रिटार्डेशन है, these are some of the symptoms अगर नहीं लेता। अब जब महिला प्रेग्नेंट होती है तो हमको इमीडिएटली फर्स्ट महीने में पता नहीं चलता, एंड दैट इज अ क्रिटिकल टाइम जहाँ पे सबसे ज्यादा ब्रेन डेवलपमेंट होता है। तो जो फोलिक एसिड सप्लीमेंटेशन है इसको मतलब प्रेगनेंसी से पहले ही चालू करना चाहिए। तो न्यूट्रिशन इज नॉट ओनली ड्यूरिंग प्रेगनेंसी बट इट स्टार्ट्स मच बिफोर दैट।
क्या ऐसे कोई सिम्टम्स हैं कि बिना टेस्ट कराए उस सिम्टम से हमें पता चले कि हमारे बॉडी में आयरन की कमी है?
सिम्टम्स में यही है कि एक तो जो है टायर्डनेस बहुत लगेगी, एंड ऑफ द डे, लाइक हम बहुत बार काफी लोगों को सुनते हैं कि एंड ऑफ द डे जैसे बस अब दिन खत्म हो जाए, हम लेट जाए, वी आर वेरी टायर्ड। ओके, मसल्स जो है हमेशा इसमें बहुत एक फटीग फैक्टर रहता है, टिंगलिंग थोड़ा सा रहता है। इसके साथ साथ जो है ब्रेन में भी थोड़ा सा धुंधला धुंधलापन रहता है, जिसको हम बोलते हैं ब्रेन फॉग, राइट। सो द थिंकिंग इज नॉट क्लियर, उसमें बहुत ज्यादा पीपल फाइंड इट वेरी हार्ड टू कॉन्सेंट्रेट। सो ये टिपिकल सिम्टम्स है जहाँ पे जरूरी है कि वी चेक आयरन लेवल्स। आयरन को जैसे दिव्या जी ने बोला, इसको विटामिन सी के साथ सप्लीमेंट करें, फोलिक एसिड लेवल्स देखें, विटामिन B12 लेवल्स देखें। तो ये जो चारों चीजें हैं इनको साथ साथ देखें। इसके साथ साथ हम ये भी देखें कि जो हमारा विटामिन A लेवल है, बीटा कैरोटीन लेवल है, इसको भी जो है भरपूर लेना है, बिकॉज ईच ऑफ दीज आर रिलेटेड टू ईच अदर।
ये बात तो तय है कि जीवन में संतुलित भोजन के साथ साथ माइंडफुल ईटिंग बेहद ज़रूरी है। इस पर हमारा स्वास्थ्य निर्भर करता है। आज के हेल्थनामा में इतना ही। विस्तार से डॉक्टरों की राय जानने के लिए हमारे YouTube चैनल हील फाउंडेशन को सब्सक्राइब करिए और उससे जुड़िए। बाकी अन्य बीमारियों पर विस्तृत जानकारी के लिए और डॉक्टरों से विस्तृत जानकारी हासिल करने के लिए आप हमारे वीकली प्रोग्राम हेल्थ फॉर ऑल देख सकते हैं, हर रविवार सुबह 8 से 11 YouTube और Facebook पर लाइव। नमस्कार।
Welcome back. This episode of Health for All is live on YouTube and Facebook. We now have the session intro video. Welcome back. We now move on to the next session. We are in the midst of the monsoon season. Of course, there has not been good news on this front as the onset of monsoon has been sluggish across India, except probably in Assam, which is reeling under floods. This special session will be on onset of monsoon preparedness for holistic health. And we have with us Dr. Kiran Seth, who comes with more than 10 years experience of clinical experience in rheumatology. She's an active member of the National Academy of Medical Sciences and deeply involved in spreading awareness on rheumatoid arthritis and has chaired various sessions. Next is Dr. Saurabh Sharma, who comes with extensive knowledge of Ayurvedic medicines and specializes in treating skin diseases and arthritis. He's a Vaidya with high interpersonal skills and has given Ayurvedic consultations to Maharshi Ayurveda Health Center, Thailand. He was awarded the Bharatiya Chikitsak Ratna Award by CEBR Pune. The next speaker would be Ms. Manjari Chandra, a functional nutritionist and a wellness coach, speaker, and author. She's also the founder of Manjari Wellness. She's the author of 2 books, Clean Up, Eat Up, Clean Up, and Heal with Foods. Last but not the least, we have Dr. Sharvari Dabde, general physician in internal medicine, Fortis La Fame Hospital, Greater Kailash. So I now hand over this platform to my colleague, Kishore Malviya, for his first round of questions.
थैंक यू सर. डॉक्टर किरण सेठ, मेरा पहला सवाल आपसे ये है कि आपने आर्थराइटिस पे बहुत काम किया है. क्या बरसात के दिनों में आर्थराइटिस की समस्याएं बढ़ जाती हैं?
डेफिनेटली बरसात के टाइम पे आर्थराइटिस की समस्याएं बहुत बढ़ जाती है और मैंने देखा है कि पेशेंट्स में भी सर्ज होता है. द स्वेलिंग्स इन द जॉइंट्स they also increase, and sometimes because of the increase in the uric acid, because of the increased humidity and the patients not taking proper water intake and dehydration, and this gouty arthritis also sees a flare. So बरसात के आने पे जोड़ों में दर्दें जो हैं वो बढ़ जाती हैं और उसका कारण या तो ह्यूमिडिटी जो इंक्रीज वाटर मॉइस्चर होता है उसके कारण, और प्लस बिकॉज ऑफ बरसात के कारण जो नॉर्मल एक्सरसाइज पैटर्न होता है पेशेंट्स का, खाने में भी कुछ बदलाव करने की जरूरत होती है, अगर वो नहीं हो पाता तो उस कारण, और प्लस मेडिसिन अगर टाइम से नहीं ले रहे तो उस कारण भी गठिया में बड़ा देखा गया.
तो आर्थराइटिस के जो पेशेंट हैं, बरसात शुरू होने से पहले ऐसा क्या करें प्रिवेंटिव कि वो इन समस्याओं से बच सके?
मेरे ख्याल से जो पेशेंट्स को मैं मैसेज देना चाहूंगी वो ये कि जब बारिशों का मौसम आता है तो ये नहीं कि अगर, क्योंकि थोड़ा सा इन लोगों के लिए ठंडा हो जाता है तो ये लोग अपने बिस्तर में ज्यादा देर टाइम स्पेंड करने की कोशिश करते हैं. तो एक तो अपनी एक्टिविटी लेवल को जो पहले मेंटेन करते हैं उसको मेंटेन करना चाहिए. और सेकेंड थिंग, इस बात का बहुत ध्यान रखना चाहिए कि इंक्रीज प्रेस्पिरेशन होती है, पसीने ज्यादा आते हैं बिकॉज ऑफ द इंक्रीज ह्यूमिडिटी. तो जो डिहाइड्रेशन है पार्ट, उसके लिए वाटर इनटेक को अपना इंक्रीज करना बहुत जरूरी होता है. और अपनी दिनचर्या को जितना भी हेल्दी बनाना है, मतलब वो उस पर कॉन्सेंट्रेट करें, ना कि जो बाहरी वातावरण बदल रहा है, जैसे बारिश हो रही है उसके साथ ठंडा लग रहा है तो वापस अपने बिस्तर पे आ गए, उस चीज को अवॉइड करना है. सो मेरे ख्याल से जो एक्टिविटी लेवल को मेंटेन करते हुए और अपने खान पान पे ध्यान रखते हुए उस पे काम करना है उनको.
डॉक्टर किरण, देश के कई इलाकों में मॉनसून की बारिश शुरू हो गई है और दिल्ली और आसपास भी अब होने वाली है, और ये आप कहें संयोग है या क्या है कि इसी समय कोरोना के केसेस भी बढ़ रहे हैं देश के कई इलाकों में. क्या मॉनसून की बारिश से इसका कोई संबंध है? क्या मॉनसून की बारिश इसको एम्पलीफाई करेगा या कंट्रोल करेगा? कुछ रिश्ता है?
आई थिंक कि मॉनसून का मतलब जो वेदर है, ये टेम्परेचर बिल्कुल एप्ट होता है किसी भी वायरल रेप्लिकेशंस के लिए. और इसीलिए अगर आपने, मतलब जब कोविड नहीं भी था तब भी जब ये मौसम आता था तो तब भी अपर रेस्पिरेटरी ट्रैक्ट इन्फेक्शंस बढ़ जाते थे, which is maybe because of the dampness, because of the again because of the weather conditions, patient not doing their regular activities, preferring to stay more indoors. And जो एक perpetual problem होती है chronic patients के साथ कि अगर वो अपनी दवाइयों के साथ भी compliance नहीं करते हैं तो ये भी add on करता है. अभी तक सर्दियों के टाइम तक और गर्मियों के टाइम में थोड़ा सा फूड हैबिट्स हमारी बदलती हैं, लेकिन जैसे मॉनसून आता है तो मुझे लगता है और भी तला वाला जो खाना खाते हैं प्लस मोर ऑफ दी मसाला वगैरह जो नॉर्मल हाउस होल्ड फूड्स में लोग यूज कर लेते हैं और पेशेंट भी उसको कंज्यूम करता है. इस समय एकदम से डिफिकल्टी आती है क्योंकि आपकी गैस्ट्रिक जो जूसेस बनते हैं और बिकॉज ऑफ द इनएक्टिविटी उनमें भी थोड़ी सी शीतलता आती है. तो कुल मिला के मुझे लगता है कि मॉनसून के आने से अगर पेशेंट्स अपने दोबारा से अपनी पूरी रहने की पद्धति को नहीं से ठीक से देखता है तो वो इन सब चक्रों में पड़ सकता है और जोड़ों में दर्द है प्लस कोविड का इन्फेक्शन. जैसे मैंने आपको बताया कि वायरल इन्फेक्शंस इस टाइम मौसम में क्योंकि वेदर जो टेम्परेचर है इट इज वेरी मच एप्ट फॉर ऑल द वायरल डिजीजेस टू फ्लेयर.
थैंक यू डॉक्टर किरण, आप हमारे साथ बने रहिए. सेकंड राउंड ऑफ क्वेश्चनिंग में फिर हम आपके पास आएंगे. मेरा अगला सवाल डॉक्टर शर्वरी से है. डॉक्टर शर्वरी
जी,
मॉनसून में वायरल फीवर के केसेस बढ़ जाते हैं
जी,
और कोरोना के फीवर्स अभी इस समय चल रहे हैं और दोनों के सिम्टम्स लगभग बराबर हैं. ज्यादातर लोग कंफ्यूज रहते हैं, ये मान लेते हैं कि ये तो वायरल फीवर है और टेस्ट नहीं कराते हैं. जब डॉक्टरों के कहने पे टेस्ट कराते हैं तो वो कोविड निकलता है. दोनों में कैसे सिम्टम्स को देखते हुए कैसे अंतर करें?
जी सर, ये हमेशा से ये एक चैलेंज रहा है हम सब के लिए क्योंकि कोरोना और जो वायरल फ्लू या नॉर्मल फ्लू, सीजनल फ्लू जिसको हम कहते हैं, उसके सिम्टम्स लगभग कई तरह से सेम होते हैं बिकॉज इट इज अ वायरल फीवर, सो इज कोरोना. तो कोरोना भी एक वायरल फीवर होने के कारण सिम्टम्स ओवरलैप जो है वो दोनों के ही होते हैं. लेकिन हमने जो ट्रेंड देखा है अभी जो पिछले 2-2.5 साल से हम देखते हुए आ रहे हैं, जब कोरोना की केसेस में सर्ज होता है तो वायरल फ्लू जो है वो एक तरह से हम इतना कॉमनली नहीं देखते हैं जितना कोरोना को देखा जाता है. उसका ट्रांसमिसिबिलिटी जो है वो ज्यादा है, खासकर अभी गर्मियों के महीनों में जब ह्यूमिडिटी थोड़ी ज्यादा हो जाती है, लोग इंडोर्स रहना पसंद करते हैं गर्मी के कारण, तो ट्रांसमिसिबिलिटी रेट जो है उसका बढ़ जाता है. तो इसके सिम्टम्स में ज्यादातर हम जो कॉमन चीजें हैं वो यही देखते हैं कि शुरुआत या तो सर्दी, नजला, खांसी, जुकाम से हो सकती है. थोड़ा बहुत माइल्ड फीवर जो है वो आ सकता है दोनों केसेस में, जो कि सीजनल फ्लू में भी हो सकता है और कोविड में भी हो सकता है. लेकिन कोविड जो है सर वो फ्रॉम वन फैमिली मेंबर टू अनदर फैमिली मेंबर, जिसका ट्रांसमिसिबिलिटी जिसको हम कहते हैं, वो थोड़ा सा ज्यादा देखा जाता है एज कम्पेयर टू द सीजनल फ्लू. ऑल्सो कोई जो भी हम वल्नरेबल पॉपुलेशन जिसको कहते हैं, जो कि खासकर हमारे बुजुर्ग लोग हैं या फिर जिनको क्रोनिक बीमारियां है, डायबिटीज है, हार्ट पेशेंट है, वो सभी जो है वो कोरोना के लिए थोड़े से ज्यादा वल्नरेबल रहते हैं. उनमें जो कोरोना होने की जो पॉसिबिलिटी है वो थोड़ी सी ज्यादा रहती है. इसलिए इन सब केसेस में हमको इररिस्पेक्टिव की सिम्टम्स जो भी है, चाहे वो मामूली खांसी है या खराश है गले में या फिर माइल्ड फीवर है 99-100 तक है, तब जब कोरोना के केसेस हर जगह, हर प्रदेश में अभी बढ़ रहे हैं, हम सबको एज प्रिकॉशनरी कोविड टेस्ट सबके लिए ही करना चाहिए. एंड आई थिंक दिस इज अ गुड प्लेटफॉर्म जिससे मैं ये मैसेज दे सकती हूँ सब लोगों को कि आप कोई भी फीवर को जस्ट सीजनल फ्लू अपने आप डिक्लेयर ना करते हुए कोविड का टेस्ट जरूर करें, क्योंकि कोविड में कई बार हमने ये देखा है कि लोगों को ठीक होने में ज्यादा समय लग जाता है. कोविड का जो फीवर का प्रोग्रेशन है या फिर सिम्टम्स का जो प्रोग्रेशन है वो 5 से 7 दिन तक चलता है. वायरल फ्लू का भी सेम होता है, लेकिन कई बार कोविड के सिम्टम्स जो है वो 2 हफ्ते तक भी परसिस्ट कर सकते हैं. इसलिए हमको कोई भी वायरल फ्लू समझ के कोविड को इग्नोर नहीं करना चाहिए, खासकर हमारे ओल्ड एज पॉपुलेशन में या बच्चों में या फिर प्रेग्नेंट फीमेल्स में.
डॉक्टर शर्वरी, एक और देखी गई है कि मानसून के समय में मलेरिया, टाइफाइड, डेंगू, ये सब इनके केसेस बढ़ जाते हैं. एक तो क्यों बढ़ते हैं और दूसरे प्रिवेंशन क्या है?
जी, डेंगू इज अ मस्किटो बॉर्न, इज अ वेक्टर बॉर्न डिसीज, हम सबको पता है मच्छर की वजह से होता है। ऑल्सो ये कलेक्शन ऑफ जो मस्किटोज है ये ज्यादातर स्मॉल वाटर कलेक्शन वाटर बॉडीज में ग्रो करता है। तो जब भी एक या दो बार बारिश होके ये छोटे छोटे एरियाज में, क्लस्टर एरियाज में वाटर कलेक्शन हो जाता है, तो उसी की वजह से मस्किटो ब्रीडिंग जो है वो बढ़ जाता है। जब मस्किटो ब्रीडिंग बढ़ता है तो उसी वजह से डेंगू जो है वो बहुत तेजी से फैलता है। खासकर दिल्ली जैसे एरियाज में जो ये ब्रीडिंग एरियाज है ये देखे गए हैं कि ये दिन ब दिन बढ़ रहे हैं, क्योंकि हर जगह पे कंस्ट्रक्शन हो रही है, हर जगह पे छोटे छोटे पार्क बने हुए हैं, या फिर लोगों में इतना अवेयरनेस नहीं है कि उनको कई बार नहीं पता लगता कि ये ब्रीडिंग एरियाज हो सकते हैं मस्कीटो के लिए। तो कूलर हो, चाहे कोई भी पानी इकट्ठा किया हो, वाटर पॉट्स में हो या फिर प्लांट्स में हो, हर जगह पे ये ब्रीड कर सकते हैं। इवेंचुअली उसका ग्रोथ जो है वो बढ़ते हुए हमको डेंगू फीवर हो सकता है। सिमिलरली टाइफाइड के लिए भी ऐसा ही होता है। सर टाइफाइड इज अ फूड बॉर्न डिसीज, माने टाइफाइड का जो है वो गट के जरिए, आप इन्फेक्टेड पानी के जरिए या फिर इन्फेक्टेड मिल्क या फूड मटेरियल के जरिए वो हो जाता है। सो नेचुरली हाइजीन जो है वो मॉनसून के मंथ्स में हम देखते हैं कि कम हो जाता है, क्योंकि वाटर कंटेमिनेशन एक बहुत ही बड़ा प्रॉब्लम है हमारे देश में, और इसी वजह से वाटर कंटेमिनेशन रिलेटेड जो भी डिसीजेस होते हैं वो सारे ही बढ़ जाते हैं। डेंगू टाइफाइड के अलावा मलेरिया भी सिमिलरली, बिकॉज ब्रीडिंग होता है, मॉस्किटोज बढ़ जाते हैं। गर्मी और ये जो टाइम होता है जब ह्यूमिडिटी और गर्मी सबसे ज्यादा होती है, ये सबसे फेवरेबल पीरियड होता है मॉस्किटोज को ब्रीड करने के लिए। हेल्थ मलेरिया डेंगू जो है ये अभी के महीनों में पीक होता हुआ नजर आता है, और फिर जैसे ही थोड़ा सा टेम्परेचर कम होने लगता है इनका ब्रीडिंग जो है वो कम हो जाता है। एंड विंटर्स में ये एब्सोल्युटली कभी भी हम इसको इतना कॉमनली नहीं देखते हैं। रही बात इसके अलावा भी और कई सारी बीमारियां होती है, जैसे लेप्टोस्पायरोसिस है जो कि अगेन कंटामिनेटेड वाटर के जरिए फैल सकता है, वो भी हम बहुत आम तौर पे देखते हैं। कोलेरा हो गया जो भी अगेन वाटर बॉर्न डिसीज, कंटामिनेटेड वाटर की वजह से लूज मोशन, डिहाइड्रेशन, ये सारी चीजें जो है ये मानसून में बढ़ती हुई इसीलिए नजर आती है बिकॉज हाइजीन मुझे लगता है कहीं ना कहीं अफेक्ट हो जाता है। कई सारी चीजें हैं जो जिसका हम ध्यान नहीं रख सकते। कई सारी जगह पे फ्लडिंग होती है। इवन पिछले साल हमने देखा कि दिल्ली के भी कई सारी जगह पे वाटर कलेक्शन हो गया था, फ्लडिंग हो गया था, और उसी के बाद जो है ये डेंगू मलेरिया वेक्टर बॉर्न डिसीज है या वाटर या फूड बॉर्न डिसीज है वो बढ़ते हुए नजर आ रहे थे। इसका प्रिवेंशन में यही सबके लिए कहूंगी सर कि ये है कि दैट वी शुड मेंटेन हाइजीन। एटलीस्ट हमारे घर में जो चीजें आती है, जो पानी हम पीते हैं, जो मिल्क प्रोडक्ट्स हम कंज्यूम करते हैं, या फिर बाहर की जो चीजें हम कंज्यूम करते हैं उसको हम बहुत अच्छे से ध्यान रखें। घर में अगर कोई ऐसे वाटर बॉडीज हम कलेक्शन, खासकर कूलर है या फिर वाटर पॉट्स है, उसको हम बार बार एवरी सेकेंड या थर्ड डे उसका पानी बदलते रहे ताकि ब्लीडिंग से हम बच सके। एंड ऑफ कोर्स बाकी सारे मेजर्स प्रिकॉशंस के लिए मॉस्किटो रिपेलेंट्स है, नेट्स है, ये सारे खासकर बच्चों के लिए यूज करें उनके बेडरूम्स में, या फिर बुजुर्गों के लिए ऐसे नेट मेशेस यूज करें जिससे मॉस्किटो बाइट प्रिवेंशन हो सकता है। और खाने में ज्यादातर हम ऐसी चीजें खाएं जो अच्छे से पकी हुई हो। रॉ फूड्स, रॉ वेजिटेबल्स को अवॉइड करें। ग्रीन लीफी वेजिटेबल से भी कई बार कंटामिनेशन को हो सकता है, तो सैलेड्स और ये सब चीजें हम अच्छे से वॉश करके ले, या फिर हम प्रॉपरली कुक्ड खाना खाए, प्रॉपरली फिल्टर्ड पानी पिए, दूध को उबाल के हमेशा यूज करें, खास करके मानसून महीने में।
चरवती जी, आप थोड़ा अपना ऑडियो लेवल बढ़ा लीजिए। और मेरा आपसे अगला सवाल ये है कि मॉनसून में टेम्परेचर के फ्लक्चुएट करने से ज्यादातर बीमारी होती है, तो क्या इस दौरान हमारी इम्यूनिटी कमजोर हो जाती है?
जी नहीं सर, मैं ये नहीं कहूंगी कि हमारी इम्यूनिटी कमजोर हो जाती है, लेकिन मॉनसून का जो सीजन है वो ओवरऑल बीमारियों के लिए काफी प्रोन माना जाता है। उसका रीजन ये है कि जैसे मैंने अभी आपको समझाया कि हाइजीन जो है वो एक तरह से थोड़ा सा कम हो जाता है। लेकिन कोई भी डैम्प एरिया जैसे होते हैं, जैसे हमारे घर में कई बार अगर किसी कारण ओस हो जाती है, जैसे विंटर के महीनों में, या फिर हम मानसून के कारण ज्यादातर इंडोर रहना प्रेफर करते हैं, तो उसमें ये हो सकता है कि हमारा जो एक्सपोजर है नॉर्मल उससे वो कम होने के कारण हम बीमारियों के लिए और ज्यादा प्रोन हो सकते हैं। बट ये कहना गलत होगा कि हमारी इम्यूनिटी जो है वो मानसून के महीनों में कम हो जाती है। हमको हमेशा ही हमारे न्यूट्रिशन पे ध्यान रखना चाहिए, चाहे वो मानसून है, चाहे वो समर है या विंटर्स है। और विटामिन डी जिसको हम कहते हैं, जो कि एक बहुत ही मेजर रोल प्ले करता है हमारी इम्यूनिटी में, उसका हमेशा ही हमको थ्रू आउट द ईयर हमको ये करना, मेक श्योर करना चाहिए दैट वी आर ऑलवेज sufficient of vitamin D to prevent from the normal viral fever जो कि हम सीजनल वेरिएशंस में देखते हैं, या फिर कोई भी और बीमारी है जिससे हमको लड़ने की क्षमता जो है वो विटामिन डी के सफिशिएंसी के साथ वो थोड़ी और बेटर हो जाती है।
थैंक यू शर्वरी जी, आप हमारे साथ बने रहिए। शंकर जी आपके पास आएंगे सेकंड राउंड में। डॉक्टर सौरभ शर्मा। डॉक्टर शर्मा, अभी इम्यूनिटी की बात हो रही थी, तो आयुर्वेद में तो इम्यूनिटी बढ़ाने के हजारों नुस्खे हैं और सबसे ज्यादा लोग आयुर्वेद की तरफ देखते हैं इम्यूनिटी बढ़ाने के लिए। हमारे दर्शकों को बताइए कि मॉनसून से पहले हमें क्या करना चाहिए इम्यूनिटी बढ़ाने के लिए ताकि हम बीमार न पड़े।
किशोर जी, बहुत अच्छा सवाल पूछा आपने। फर्स्ट ऑफ ऑल थैंक यू एवरीवन, क्योंकि बहुत अच्छा मंच है ये समझने का और चीजों को इनकॉर्पोरेट करने का। देखिए, आयुर्वेद इम्यूनिटी को ओज के रूप में देखता है, यानी आपका ओज कैसा है। ये चेहरे वाला ओज नहीं है, वो ओज है जो कि आपके शरीर में बनता है, राइट। सो होता क्या है कि आयुर्वेद हमेशा कहता है कि आप डायरेक्ट, देखिए जैसे 2-3 साल कोरोना रहा तो एवरीबॉडी टॉक्ड अबाउट इम्यूनिटी बढ़ाइए, बट नो वन थॉट अबाउट कि इम्यूनिटी कैसे बढ़ेगी। गिलोय लेने से या नीम लेने से, आंवला लेने से इम्यूनिटी नहीं बढ़ती। इम्यूनिटी बढ़ती है आपकी आहार शक्ति, यानी आपके जठराग्नि, यानी आपके डाइजेस्टिव फायर को ठीक करने से। सो अकॉर्डिंग टू आयुर्वेदिक कंसेप्ट्स, इम्यूनिटी का प्रोसेस ये है, आपने भोजन खाया यानी आहार रस बना, फिर रस, रक्त, मांस, मेद, अस्थि, मज्जा, शुक्र, और उसके बाद जाके आपकी इम्यूनिटी बनी। यानी जो आपका ओजस है, दिस इज अ प्रोसेस और दिस इज अ प्राइमोर्डियल एक्सट्रैक्ट ऑफ ऑल द 7 टिश्यूज और धातुज इन योर बॉडी। इट मींस पर्पसफुली you need to work on balancing or increasing your digestive fire. If your digestive fire is balanced, you have a better immunity. हम सारी दवा ले सकते हैं, सारे नुस्खे अपना सकते हैं, लेकिन जब तक आपकी अग्नि नहीं होगी अच्छी, तब तक कुछ नहीं होगा। एक सिंपल एग्जांपल देता हूँ, आपने देखा होगा, हम लोग बचपन से सुनते आ रहे हैं च्यवनप्राश खाइए, अश्वगंधा खाइए, बट 15 साल की प्रैक्टिस में मैंने ऐसे भी लोग देखे हैं जो कहते हैं च्यवनप्राश खाने से सर मुझे कुछ हुआ नहीं। या आपने घर में देखे होंगे लोग कहते हैं च्यवनप्राश खाया लेकिन पेट अफर गया या ब्लोटिंग हो गई या ये हो गया, because no one thought about working their digestive fire. So the purpose is increase the digestive fire, or let's say at least take the digestive fire to optimum level so that the digestive fire can absorb the food, so that digestive fire can absorb the nutrition, so that digestive fire can absorb at least giloy, है ना। वो तब इम्यूनिटी अच्छी बनेगी जब आपकी अग्नि अच्छी होगी। और हालांकि दोनों डॉक्टर्स ने बहुत ही अच्छी अच्छी बातें बोली, बट थोड़ा सा आयुर्वेद का कंसेप्ट थोड़ा सा अलग है यहाँ पे। आयुर्वेद ये कहता है कि ग्रीष्म ऋतु यानी समर्स और वर्षा ऋतु यानी मानसून, इस समय आपकी अग्नि यानी भोजन को पचाने की क्षमता प्लस आपका बल, इट मीन द स्ट्रेंथ ऑफ द बॉडी इज अ लिटिल वीकर। वी विल बी टॉकिंग अबाउट द डाइट एंड डेली रूटीन कि क्या करना चाहिए अगर समय हुआ तो, लेकिन यहाँ पे इम्यूनिटी तब बढ़ेगी जब आप अपनी अग्नि को ऑप्टिमम रखेंगे। फॉर एग्जाम्पल एक छोटी सी बात बोलता हूँ कि बारिश होती है तो हमारा बड़ा मन करता है पकोड़े खाओ, ये खाओ, हैवी खाओ, राजमा, अरे सामने वाले के छोले भटूरे बड़े अच्छे हैं, बट वी डोंट थिंक। अब ये देखिए, जैसे डॉक्टर शर्वरी और डॉक्टर किरण ने भी बोला कि इसी समय पे ये सारी चीजें, है ना, फूडबॉर्न डिजीज, वाटरबॉर्न डिजीज क्यों होते हैं? बिकॉज आपकी अग्नि कम होती है। सो दिस इज द टाइम व्हेन यू मस्ट हैव गुड फूड, नॉट हैवी फूड। हैवी फूड खाओगे तो अग्नि नहीं होगी, अग्नि खराब हो जाएगी, नहीं खराब होगी तो ओजस खराब हो जाएगा। अब आपने जो आपका मुख्य सवाल था कि इम्यूनिटी कैसे बढ़ाई जाए, मैं तो ये कहता हूँ आपके भोजन में सब कुछ है, योर फूड हैज गॉट एवरीथिंग, आपको कुछ भी सेकेंडरी सोर्स पे जाने की जरूरत नहीं है। बट आप अपनी डाइजेशन फायर का ध्यान रखिए, और जो सीजनल रिजाइम होता है, जो सीजनल रेजिम होता है, जैसे डेली रूटीन होता है उसी तरह हर सीजन का एक रेजिम होता है, उसको फॉलो करिए। आपको अलग से कुछ करने की जरूरत नहीं है। अदरवाइज अश्वगंधा, शतावरी, गिलोय और महर्षि आयुर्वेद का एक बहुत ही अच्छा प्रोडक्ट आता है जिसे महर्षि अमृत कलश कहते हैं, वो एंटीऑक्सीडेंट बहुत ही बढ़िया। आई मीन मेरे पास शायद पूरे दिन लग जाएगा कहने के लिए, तो बहुत सारी चीजें हैं, बट मेरा सजेशन ये है कि आप अपने लाइफस्टाइल पे काम करिए, आपकी इम्यूनिटी अपने आप मेंटेन रहेगी।
डॉक्टर साहब, लोगों की एक शिकायत ये भी रहती है कि आयुर्वेद में परहेज बहुत ज्यादा है। अब जैसे अभी आपने पकोड़े का जिक्र किया, अब बरसात में पकोड़े खाने का मन करे तो आयुर्वेद इसकी इजाजत नहीं देता है। तो कुछ तो ऐसा आयुर्वेद में होगा जो हमें थोड़ी छूट दे कि हम बरसात में कम से कम पकोड़े खा सकें या कुछ एक्स्ट्रा चीजें हम खा सकें जो साल भर नहीं खाते हैं आयुर्वेद को मानते हुए। तो ऐसा क्या है जो हमें बरसात में बीमारियों से बचाए और हमें परहेज पे थोड़ा सा कम ध्यान दे?
किशोर जी, अच्छा सवाल पूछा आपने दोबारा। देखिए, यहाँ जो परहेज है ये आपको बाउंड करने के लिए नहीं है, या जो रिस्ट्रिक्शंस है आपको बाउंड करने के लिए, बिकॉज none of the other two doctors, even me, we don't want that someone takes any medicine. मैं तो ये भी नहीं बोलता आयुर्वेद की दवाई भी क्यों लेनी भाई. जैसे हम बचपन से सीखते आ रहे हैं, आपको याद है हम जब पढ़ाई करते तो हमारे पिताजी हमें एक व्हाइट पेपर लिखते थे, टाइम टेबल, सुबह इतने बजे उठना. मैंने तो हमेशा अपने टेबल के आगे लगा रखा था, स्टडी टेबल के आगे, इतने बजे उठना, ये पढ़ना, इस समय ये करना, ये लंच, ये डिसिप्लिन. सब लोग सब कुछ कहते हैं, बट मैं एक बात बोलता हूँ कि डिसिप्लिन इज द की टू गुड हेल्थ. अगर आप डिसिप्लिन में, और देखिए कभी कभी सब कुछ होता है, ऐसा नहीं है कि हम वन में रह रहे हैं, मुझे भी पता है सोशल लाइफ सभी की, हमारा कभी कभी मन भी करता है, बट अगर मुझे ये पता है, फॉर एग्जाम्पल सिंपल सी बात समझिए, मुझे कोल्ड है मान लीजिए और मेरे सामने आइसक्रीम रखी है और मेरा मन कर रहा है खाने का, इसको आयुर्वेद में प्रज्ञा अपराध कहते हैं, जिसे कहते हैं मिस्टेकन इंटेलेक्ट. जब आपको पता है वो चीज आपके लिए गलत है, फिर भी देखिए मैं बड़ी बात नहीं बोलूंगा कि आप अपनी इंद्रियों पे, अपने मन पे कंट्रोल करिए, बट ये जरूर कहूंगा कि देखिए और सीजन भी तो है. देयर आर, आई मीन इंडिया वी आर वेरी फॉर्चुनेट दैट वी हैव 6 सीजंस, राइट. सो जो विंटर्स वाला टाइम है, दैट टाइम योर अग्नि डाइजेशन इज वेरी गुड. आपने इस चीज को देखा होगा, गोंद के लड्डू खा लो, ये खा लो, हैवी हैवी खा लो, हमारे घरों में बनते हैं. वो कब बनते हैं? विंटर्स में. समझ में कोई नहीं देता क्यों? बोले गर्म होते हैं. जी गर्म नहीं होते, आपकी अग्नि यानी डाइजेशन पावर वीक होती है, इसलिए कहा जाता है. सो अगर पकौड़े भी खाने हैं तो विंटर्स में खा लीजिए ना, हाँ कौन मना कर रहा है. अभी आप प्रज्ञापराध मत करिए. फॉर एग्जाम्पल किशोर जी, मैं नॉर्मल बात बताता हूँ, हमारी प्रैक्टिस में हमेशा बोलते हैं कि ये जो सीजन है इसमें दवा के पेशेंट्स आते हैं, बिकॉज हर पेशेंट प्रज्ञापराध करता है, अपने दिमाग से ज्यादा दिल की सुनता है कि हाँ खा लो. लेकिन फिर भी अगर कभी खाते हैं तो देयर आर सर्टेन डाइजेस्टिव एड्स, जैसे हम नॉर्मल नाम सुना होगा, त्रिफला, सब लोग जानते हैं. ये मैं मेरे सारे पेशेंट्स को बताता हूँ, एक सिंपल से ट्रिक बताता हूँ. ट्रिफला इज नॉट अ लेक्सेटिव, इट इज अ वेरी गुड इंटेस्टाइनल टोनर, जो कि बॉडी में से टॉक्सिन यानी आग को निकालता है. मान लीजिए आज किशोर जी का बर्थडे था, डॉक्टर साहब को इनवाइट किया, आज तो हम कुछ ना कुछ तो खाएंगे. दोनों दोस्त मिले, हमने खा लिया और मुझे पता था मैंने गलत खाया आज, तो कुछ नहीं किया, मैंने घर आके 2-3 टैबलेट त्रिफला की खा लिया. आजकल हर चीज टैबलेट फॉर्म में मौजूद है, ऐसा कुछ नहीं, चूरन वगैरह होता है, वो ली तो टॉक्सिन को मैंने एक्यूमुलेट होने से पहले रोक लिया. शाम को हम दोनों बैठे थे, हमने पकोड़े खाए, कोई बात नहीं, खा लिए पकोड़े. क्या पता मेरी अग्नि यानी डाइजेशन कैपेसिटी बहुत स्ट्रॉन्ग थी, मुझे तो कुछ नहीं हुआ. एंड किशोर जी से यार डॉक्टर साहब थोड़ा सा पेट हैवी हो रहा है, मैंने कहा त्रिफला खा लो, हिंगवाष्टक चूर्ण खा लो, या कुछ मत छोड़ो, चलो ठीक है जिंजर तो हमारे घर में होता है, या चलो वो भी छोड़ो, हींग तो घर में होती है, थोड़ी सी हींग हल्के से 2-3 चुटकी नमक में मिला के गर्म पानी से फाँक लो. तो डाइजेस्टिव एड्स हमारी सारी फार्मेसी हमारे किचन में मौजूद है. वी जस्ट नीड टू थिंक अबाउट इट एंड डू इट. बट माय फ्रेंडली सजेशन टू ईच एंड एवरी व्यूअर इज दिस, प्रज्ञापराध से बचिए, आप रेजाइम फॉलो करिए, रेजिम फॉलो करिए. मार्क माय वर्ड्स, आपको कहीं जाने की जरूरत नहीं है.
डॉक्टर साहब, हमारे शो में आज एक जानी मानी डाइटिशियन भी है, खान पान से जुड़े सवाल हम उनसे आगे पूछेंगे. आपने जो कुछ बताया उसके बारे में भी पूछेंगे. आपसे एक मैं आखिरी सवाल पूछना चाहता हूँ कि मैं ऐसे बहुत से लोगों को जानता हूँ कि बरसात होते ही उन्हें वायरल फीवर होता है, फिर वो एलोपैथिक दवा खाते हैं और 3-4 दिन तक बुखार रहता है, फिर वो ठीक हो जाते हैं. क्या आयुर्वेद में कोई घरेलू नुस्खा ऐसा है कि बरसात शुरू होने से पहले हम उसका सेवन करें कुछ दिनों तक, तो वायरल फीवर हमें बरसात में हो ही नहीं?
अगेन अच्छा सवाल आपका किशोर जी. देखिए वही बात, उसी बात को मैं तीसरे सवाल में भी उसी बात को रिपीट कर रहा हूँ. देखिए आपको इन्फेक्शन, वायरल फीवर वगैरह तब होगा, कब होगा? 2 पॉसिबिलिटी. पहली पॉसिबिलिटी, जैसा कि डॉक्टर शौर्य और डॉक्टर किरण ने बोला कि भाई फूड बोर्न डिजीज है, वाटर बोर्न डिजीज है, वाटर लॉगिंग हो गई, तो वहां से कुछ बैक्टीरिया या वायरल ग्रोथ हुई और उसकी वजह से हुआ. एक तो ये चीज होगी, उसको ऑब्वियसली हम प्रिवेंट करें. और दूसरी चीज, हम अपनी अग्नि, हम अपनी स्ट्रेंथ, हम अपनी बॉडी को रखें ही ऑप्टिमम. नुस्खे तो बहुत सारे हैं, लेकिन अब जैसे सिंपली ये वर्षा ऋतु है, 1 मिनट और लूंगा, इसमें वायु बढ़ती, वात इन एयर एलिमेंट बढ़ता है. तो जैसा डॉक्टर किरण ने बोला, रूमेटिज्म के केसेस ज्यादा आते हैं, है ना, कहा उन्होंने, तो उसी चीज को मैं भी कंटिन्यू करता हूँ. यस, रूमेटिज्म के केस ज्यादा आते हैं, बिकॉज अकॉर्डिंग टू आयुर्वेद दिस इज द एग्रीवेशन ऑफ वाता डोमिनेंस. इट मींस एयर एलिमेंट गेट्स मोर डोमिनेंट दीस डेज, इट गेट्स प्रकोपित, एंड दैट्स व्हाई ऑल काइंड ऑफ पेन डिसऑर्डर्स, सर्वाइकल स्पॉन्डिलोसिस, लंबस, मेरे पास तो केसेस आने भी शुरू हो गए हैं, स्पाइनल प्रॉब्लम्स की, आर्थराइटिस के, ऑल काइंड ऑफ पेन डिसऑर्डर पेशेंट्स कम. प्लस आप इस चीज को नोटिस करेंगे, अभी बहुत सारे लोग एसिडिटी शुरू हो जाएगी लोगों को कहना कि मुझे एसिडिटी हो रही है, इम्प्रॉपर डाइजेशन, इम्प्रॉपर ईटिंग हैबिट, ऑल दोस थिंग्स. वायरल फीवर भी इस समय सबसे ज्यादा होता है. क्यों? क्योंकि आपकी जब अग्नि कम होती है तो आपकी, अकॉर्डिंग टू आयुर्वेद, आपकी ओजस भी कम होता है. अगर आपको अपना ओजस बढ़ाना है तो आप अपनी अग्नि बढ़ाइए. इसका मतलब ये जो सिंपल सा नुस्खा हुआ वो ये हुआ, जिंजर यानी जिसे हम अदरक बोलते हैं, थोड़ी सी अदरक को ग्रेट कर लीजिए हल्का सा, उसमें आधी चम्मच शहद, बहुत ज्यादा नहीं, केवल आधी चम्मच शहद, और 2 से 3 चुटकी दालचीनी मिला लीजिए. इट विल बिकम अ पेस्ट. इसको आप रोज सुबह सुबह ब्रेकफास्ट करने से पहले लीजिए. सुबह का समय कफ का होता है. वायरल डिसऑर्डर सारे अकॉर्डिंग टू आयुर्वेद कफ के डिसऑर्डर होते हैं. तो अगर आप सुबह लेंगे, डाइजेशन फायर बेटर होगी, एलिमिनेशन अच्छा होगा, बॉडी में टॉक्सिन एक्यूमुलेट नहीं होगा, प्लस किसी भी तरह के वायरल इन्फेक्शन से आप अपने आप को बचा पाएंगे। एक तो ये बात होगी। दूसरी बहुत ही सिंपल, सुबह सुबह पानी की एक बोतल लीजिए, सिंपल, चाहे वो मैं बैठा हूँ कांच की लीजिए, बेटर नहीं तो प्लास्टिक की भी, तो कोई दिक्कत नहीं। 2-3 काली मिर्च कूट के उसमें डाल दीजिए, 4 से 5 तुलसी के पत्ते डाल दीजिए। सो हमें कुछ गर्म नहीं करना, कुछ भी नहीं करना, और पूरे दिन इसी पानी को पीजिए। देखिए, क्योंकि तुलसी अकॉर्डिंग टू आयुर्वेद इज द बेस्टेस्ट एंटी माइक्रोबियल हर्ब। तुलसी हमारे घर में, काली मिर्च हमारे घर में, इसको यूज करिए, आप अपने आप को बचा पाएंगे।
थैंक यू डॉक्टर साहब, आप हमारे साथ बने रहिए। सेकंड राउंड में हम दोबारा लौटेंगे आपके पास। डॉक्टर मिस मंजरी चंद्रा, नमस्कार। मॉनसून में नमस्कार। मॉनसून में एक स्वस्थ आदमी का डाइट प्लान क्या होना चाहिए, और स्वस्थ आदमी का भी और स्वस्थ रहने के लिए भी?
एक तो वही जो सभी लोगों ने बताया कि इन्फेक्शन, सबसे पहला ध्यान इस समय,
थोड़ा ऑडियो बढ़ा लें आप अपना।
आप मुझे सुन पा रहे हैं?
जी जी जी।
तो सबसे पहला प्रॉब्लम लोगों को यही होता है कि रिपीटेड इन्फेक्शंस होते हैं मॉनसून में। पेट खराब हो गया, सर्दी जुकाम हो गया, बुखार हो गया, कोविड तो है ही ऑफ कोर्स अराउंड। तो पहली चीज डॉक्टर शर्वरी भी बता रहे थे कि कच्ची चीजों से इन्फेक्शन होता है। क्या होता है, कई बार हम बाहर का गन्ने का रस मिल रहा है, वो पी लिया, धूप में निकले हैं, या बाहर फ्रूट चाट मिल रही है, वो खा ली, तो वो हेल्दी तो है बट हाइजीनिक नहीं होती है। और क्योंकि इस समय वायरस बैक्टीरिया का मल्टीप्लिकेशन ज्यादा है, तो इन्फेक्शन होने के चांसेस। तो बाहर का खाना एज अ थंब रूल बरसात में नहीं खाना चाहिए। जब सबसे ज्यादा गोलगप्पे खाने का मन करता है उस वक्त नहीं खाना चाहिए, बिकॉज इस समय इन्फेक्शन बहुत फैल जाता है। दूसरी बात ये कि हम अपने घरों में बारिश में चाय पीने का, पकौड़े खाने का मन तो करता ही, बट देयर आर लॉट ऑफ अदर थिंग्स जो हमारे गट की लाइनिंग को इंटेग्रल रखते हैं और इन्फेक्शन बचाते हैं। जैसे कि फॉर एग्जांपल काढ़ा तो हमें पता ही है, बट हमारे घरों में ना ब्रॉथ बनता था पहले। ब्रॉथ का मतलब होता है कि आपने पानी में खूब सारी सब्जियां डाल के धीमे धीमे आंच पे वो पक रही हैं। ब्रॉथ, जिसको हम बोन ब्रॉथ या वेजिटेबल ब्रॉथ कहते हैं, उसको हम एक तरह का ऐसा खाना मानते हैं जिसमें एक अमीनो एसिड होता है, ग्लूटामीन। वो ग्लूटामीन हमारी इम्यूनिटी बढ़ाता है और हमारी चीज लाइनिंग जो गट की होती है उसको रिपेयर करने में हेल्प करता है। तो इसलिए ब्रॉथ, सूप, घर में बने स्ट्यू, करी, ये सब चीजें अच्छी होती हैं खाने में। अगर आपको सैलेड्स खाने हैं तो घर में ही काट के खाएं। रेडी टू ईट सैलेड या पहले के कटा हुआ रखा हुआ बाहर, उसको नहीं खाएं। दूसरा, आई थिंक एक और प्रॉब्लम जो होती है कि हम तला भुना खाते तो हैं, बट ज्यादातर जब हम तला भुना खा रहे हैं बारिश में, वो बाहर का होता है। तो ऐसा मनाही नहीं है, आप ऐसा नहीं कि पकौड़े नहीं खा सकते, आप खा सकते हैं, पर अगर घर में बना के और गुड क्वालिटी फैट में बना के, या तो कोकोनट ऑयल यूज करें या कच्ची घानी का सरसों का तेल या घी इस्तेमाल करें, रिफाइंड ऑयल वगैरह इस्तेमाल नहीं करें, तो वो एक हेल्दी तरीका है। थोड़ा अगर आप पनीर के पकौड़े या गोभी, पालक ये सब खाना चाहते हैं तो अपने घर में बना के खाएं। एक और चीज आई थिंक इज दैट माइक्रो न्यूट्रिएंट्स पे ध्यान देने से, और एक हम एंटीऑक्सीडेंट्स बोलते हैं जो कि हमें इन्फेक्शन से बचाते हैं। तो एंटीऑक्सीडेंट्स विटामिन सी, विटामिन ई, सेलेनियम, जिंक, ये सब माने जाते हैं। तो अगर हम अपने खाने में थोड़ा नट्स एंड सीड्स, herbs and spices, fruits, whole fruits, not juiced fruits is include करेंगे। स्पेशली जो अभी ऑरेंजेस, बेरीज इस समय सीजन में है, अब जामुन है सीजन में, बेर, बड़ा जो हमारे इंडियन बेर होता है, दैट इज इन सीजन। ये सब चीजों में एंटीऑक्सीडेंट्स की मात्रा ज्यादा होती है। ये लेने से आपका इन्फेक्शन कम होगा, बिकॉज आप एंटीऑक्सीडेंट्स ले रहे हैं। And I think mostly another last point was that patients जिनको already chronic diseases हैं, kidney patients या diabetes के patients, अगर उनको secondary infection हो जाता है तो बहुत problem हो जाती है, because प्राइमरी डिजीज के साथ सेकेंडरी डिजीज अगर होती है तो उससे उनको बहुत हेल्थ पे इम्पैक्ट पड़ता है। इसलिए इट्स इक्वली इम्पोर्टेंट कि जो हमारे घरों में जिनको भी हार्ट डिजीज या किडनी डिजीज या किसी भी तरह का कैंसर या डायबिटीज है, उनको स्पेसिफिकली वेल कुक्ड, होम कुक्ड फूड ही दें।
मंजरी जी, मॉनसून के बारे में एक बात और कही जाती है, पता नहीं ये सच्चाई है या मिथ है, कि नॉनवेज नहीं खाना चाहिए।
खास करके फिश, बरसात में फिश बिल्कुल नहीं खाना चाहिए। कितनी सच्चाई है इसमें?
एक्चुअली मीट और फिश के साथ प्रॉब्लम ये कि आप सोर्सिंग कहाँ से कर रहे हैं। ज्यादातर जो मीट और फिश अवेलेबल है दिल्ली में, अगर आप किसी मार्केट में जाएंगे तो वो बहुत ही पुअर क्वालिटी का है। मतलब आपको पता है कि किस तरह हमारे पोल्ट्री फार्म्स में चिकन रखे जाते हैं, हाइजीन बहुत पुअर होता है वहां पे, बहुत ही पुअर। क्योंकि इतना पुअर हाइजीन है, वो बर्ड्स ही इन्फेक्टेड है, वो चिकन या मटन इन्फेक्टेड है तो आपको इन्फेक्ट कर सकता है। प्लांट्स में ये नहीं होता है, बिकॉज प्लांट्स कैन नॉट इन्फेक्ट यू। आप प्लांट बेस्ड फूड खाएंगे तो उससे आपको, जब तक वो बैक्टीरिया मतलब बहुत ही अनहाइजीनिक ना हुआ, वो बैक्टीरिया लोड नहीं होता है। लेकिन मीट में हमेशा ही देयर इज अ लोड ऑफ वायरस एंड बैक्टीरिया, तो पैरासाइट्स भी होते हैं कई बार, तो इन्फेक्शन की चांसेस ज्यादा होती हैं। और फिश स्पेशली इन अ सिटी लाइक दिल्ली, क्योंकि अगर आपको फ्रेश फिश खानी है, देखिए मैं एक एग्जांपल के तौर पे दूंगी, इट्स नॉट अबाउट अ सर्टेन रेस, बट इन दिल्ली में काफी बंगालीज रहते हैं। यस, देयर आर एरियाज जहां बंगालीज रहते हैं। बंगालीज जब बंगाल में रहते थे ओरिजिनली, तो वो समुद्र के पास थे, तो वहां फ्रेश फिश आती थी, फ्रेश कैच होता था, लोग उसको पका के खाते थे। वही लोग जब दिल्ली आगे तो उनकी खाने की हैबिट्स तो वही रही, बिकॉज वो फिश खा के ही बड़े हुए। बट यहाँ पर वो फिश मिलती नहीं। जो यहाँ पर फिश मिलती है वो छोटे छोटे तालाब में ग्रो करते हैं, पॉन्ड्स में, जिनमें बहुत ज्यादा मर्करी, लेड, आर्सेनिक, कैडमियम ऐसे टॉक्सिन्स पाए जाते हैं उन फिशेस में, क्योंकि वो इंडस्ट्रियल वेस्ट उन पॉन्ड्स या लेक्स में जा रहा है और वो फिशेस को टॉक्सिक बना देता है। इसलिए अगर आप फिश या मीट खा रहे हैं तो मीट कहाँ से आ रहा है वो देखना जरूरी है, कि ऐसी जगह से ना हो जो इन्फेक्शन कॉज कर सके। और अगर आप फिश खा रहे हैं तो रिवर फिशेस खाएं, पॉन्ड्स में जो फिशेस ग्रो की जाती हैं वो नहीं खाएं, जो स्ट्रीम में, जो फ्लोइंग वाटर में फिश ग्रो होती है वो वाली फिश खा सकते हैं।
थैंक यू मंजरी जी, आप बने रहिए हमारे साथ सेकंड राउंड क्वेश्चनिंग के लिए। ओवर टू यू मिस्टर शंकर।
Thank you, Kishore. Before we move on to the second round of questions, we would play a short wellness video. How does food or eating habits affect emotions?
Certainly, since Vedic culture, we have been, imbibing since a long time, thousands of years from the time, when the civilizations even started. Since then, we know that, food which has higher life force and which food has lesser higher, life force. So, natural things like, green leafy vegetables and all, they have higher life force. Whereas anything that we consume in form of non-veg, etc., doesn't have that kind of life force. But it's just because of our taste that, and the marketing strategies that a lot of brands do around what they have to sell in the market, we are consuming that food. So now the point here is that we know that this is exactly what we have to eat. We need to eat more fruits, green vegetables and all of that. But the point is only about thinking, then why are we not doing it? When we all know that this is exactly what we have to do. So then, that is the time when we have to take a step back and really see what's happening inside of us, which is leading to not to take those, correct actions. So what really happens is that when we do a little scan of our mind, we realize that it is because of stress, anxiety, loneliness, boredom that a lot of times we tend to emotionally binge eat without even knowing that, we don't want to eat, but then we just tend to open the fridge and eat something, a nice cake. Actually what was happening in the mind was I was stressed because somebody said something to me. Okay, that was happening in the back of my mind, and I just mindlessly went and took out that stuff and I ate it. So this is exactly what we really need to reflect back, that what's happening with me. If we take a step back and see, why am I gaining all this weight? Why am I emotionally eating setting and do a little bit scan of what emotions are triggering me to take that.
Welcome to the second round of questions, and I will start with Dr. Kiran. Dr. Kiran, are you available?
Yes.
Yeah, Dr. Kiran, is rheumatoid arthritis a problem of old people, or do you see younger generation also having rheumatoid arthritis?
Rheumatoid arthritis, it is a polyarticular disease and it is polygenic. There are many factors which are responsible for it. And it can be seen like in the younger, even in the newborns also, even like in the first year, second year of life, they are having like arthritis, joint pains. But usually like it is in the childbearing age, and then there is a surge when there is a menopause. So because maybe the hormones are also contributing. So there are two ends like we are seeing. So it is not the disease only to the elderly or this thing. It can happen around this childbearing age as well as in the younger population, and there maybe it is undifferentiated arthritis or the juvenile arthritis that we classify.
So are you saying that it is more common among women?
It's very much common in women, and it is said maybe the hormonal factor also contribute to it. The female like estrogen, sometimes it is related to the disease.
So is knee replacement an option?
See, as I see osteoarthritis, because osteoarthritis is a disease there are many other hormones as well as the cytokines. Now they are implicated in its formation. Then the uric acid also contributes. Along with that, the aging. So osteoarthritis, the weight, there are many aspects of the disease. So I would say if the patient can work in the initial 5-7 years when the disease has just entered into the body or when their joints are hurting, and it is the initial time, if something can be done at that time, then knee replacement can be avoided. So I always tell people to follow EARN principle, that is EARN. As we go out of the house, make ourselves uncomfortable to earn our livelihood. In the same way, for your joints also, you have to follow these 4 principles. That is, E is the exercise. So about 40 minutes, 45 minutes of an exercise where your all joints are worked out, that is very important, along with some cardio and some walking. A is your attitude. What kind of attitude you are having in your life and also towards your disease. So people with rheumatoid arthritis who are developing secondary osteoarthritis, suppose it is just like that कि अगर आप किसी बच्चे को बहुत डांटते रहोगे हमेशा तो वो और ज्यादा उपद्रव मचाएगा. इसी तरह से अगर आप अपनी डिजीज को बहुत ज्यादा कर्स करते हो कि इसकी वजह से मैं ये नहीं कर सकता, इसकी वजह से ये नहीं हो सकता. So disease acceptance and then working towards it, it also helps. If your attitude is good, if you just imbibe, okay, I am having this disease, now I have to do these 4-5 things to make myself happy and healthy. So that will really help. Third is the rest. A proper rest, how much we are resting and during what time. See, the population, the younger population who are working at night, and 10 to 2 is our REM sleep. That is the time when the body gets rejuvenated and everything. But most of the people, they're watching TV, they're on their phones, maybe they're doing late night works. So my suggestion to the patients is if they somehow can get 10 to 2 sleeps, maybe they can get up at 3 or 4 a.m. and they can start their day early. That will really help, because 10 to 2, our biological clock is working in such a way that it is healing our body. And then the nutrition, of course, so much is being talked about. I would add one thing, like when the fish question was asked, I have been taught from the very younger days that these 4 months, where there is no R in those, like January, February, March, they have got R. But May, June, July, August, they don't have R. So these 4 months, people should avoid fish because this is the breeding time for them. So they breed, they are multiplying, and that is the reason like we should not eat them. And maybe the other things, and even pakoras thing, I think maybe we can add the carbonatives like hing, adrak, and these in the pakoras. And maybe you can have like avoid those heavy pakoras like paneer and all. You can have palak and this. So you can have pakoras also because just you have the right recipe. So knee replacement, I think if the people can follow this earn principle, then knee replacement is not the option. If you work, you should maintain your weight. You should try to maintain the activity around the joints. There are some supplements also and a rheumatological quite assessment to know whether the uric acid is contributing to the increased pain in the joints because we have to know the exact cause. Maybe there is a bursa. There are so many things around the knee. So I don't think so. Knee replacement should only be done when the patient's muscles and the joints, they give away. It's grade 4 and above, and the patient activity is really affected.
Thank you. I'll come back to you. And I will move on to Dr. Saurabh. Dr. Saurabh, can you unmute yourself? Dr. Saurabh, you have been lecturing on Ayurveda abroad and other things and all, but one doubt that I have is how do you actually explain the digestive fire?
See, that's a very good question, sir. Because, digestive fire is, if I would like to correlate with the enzymes, gastric acid, pancreatic juice and other things, that is different way. But I usually try to make people understand and let's say to understand and feel it, how basically digestive fire works. It's very simple. I just have to tell them that, okay, do it, experience it, and then you'll understand what is basically the digestive fire. It is not, as you all understand very well that, everybody has a different kind of constitution, not Ayurveda, but in general also, mental constitution, physical constitution. The same way everyone has a digestive fire, simply. So it's very important. I'm not yet talking about the pulse diagnosis and other things. I'm just talking about the practical experience of knowing yourself. It's very important to know yourself because this is very, very simple and very, very common that, if we 9 people are sitting together and having the same food, we may have a different kind of experience after having the food. Somebody would still be hungry. Somebody would still be, somebody will be bloated. Somebody will straight away rush to the loo and things like that. So the same way I explain people that, digestive fire is something which is basically, let's say, the capacity of your body, or let's say the tolerance of your body for any kind of external food, which you should experience, not like understand what I'm saying, just experience it. These lactose intolerance, gluten intolerance, and then all kind of intolerances and all kind of allergies to certain food stuff. This is something which you can really experience. But I am very easily, I'm very happy to make you understand how it is happening and what is the solution for it. So, likewise.
Yeah. So, apart from that, it is said that during monsoon, diseases aggravate. But at the same time, monsoon is the ideal time for rejuvenation also. Is that correct in Ayurveda?
Absolutely. This is the head-on question. Absolutely right. I'll just take 2-3 minutes for this. According to Ayurveda, as I said in the beginning, in the first few answers, that this is the time of Vata aggravation. It means air is aggravated. So all kind of disorders which are related to the Vata, or let's say the air imbalance happen, like pain, dryness, and all those things. And also this is said that based on the Ayurvedic concepts, this is the accumulation of Pitta dosha. It means the fire element gets accumulating in the body. In the next season, it is going to get manifested. In the autumn, it will be manifested in terms of skin disorders and acidity and other things. And third, this is the time when there's a lot of damp outside. It means the kapha, the water content is also aggravated. So from my perspective, this is the time when all the 3 doshas, sorry, this is a little Ayurvedic at the doctors, but you guys will understand because this is very interesting actually. It's nothing to do about allopathic or Ayurvedic. This is very interesting actually. So air, fire and water, Vata, Pitta, Kapha, all 3 are in vitiated states. They all are vitiated, right? So this is the best time for the cleansing of the body. This I always tell my patient, this is the best time for Panchakarma. Go for it. Because the doshas, or let's say the toxins are already vitiated. For example, if some toxin is here in my throat, I have throat sputum, It is easy to spit it out. But if it is there in my lungs, I need to aggravate it, then bring it to the throat, and then I will spit it out, right? So all the three doshas are in the best form where you can, I mean, from on a very personal perspective, my hospital, this time is absolutely full. We don't even have a place of a single half an hour appointment. We are absolutely full because this is the best time. And now monsoon is going to be full because this is the best time to clean your body. Not with the panchakarma also, but also home detoxes like we talked about, ginger, fenugreek and other things. You can do the very good detoxification. You can make your body clean for the next season, upcoming season, and then you can have all these kind of rejuvenation things where you can have Chawanprash and all those things, Amrit Kalash and everything, and the absorption will be better. So the let's say so that the benefit of what you will have further, any kind of food, even not herbs or rasayanas or medicines also, will be much better. So this is really the best time for panchakarma and detoxification and bringing the immunity back. The immunity which was very low in the summers because there's a lot of heat outside, we were starving, dehydrating. This is the time to clean and start taking the rasayanas or the herbs or let's say good spices so that we can make our immunity that strong. Because my friends, autumn and then winters are also called to be a flu season. So let's prepare our body, prepare our ojas, prepare our immunity so that we don't catch anything further.
Well said, Dr. Sharma. I'll come back to you for last round of questions. I'll now move on to Miss Manjari. Manjari, welcome back. Glad to have you on our show. It's always a pleasure having you on our shows. Now, you're a leading nutritionist, Manjari. Now, it is said that climate change reduces the nutrient content of foods like rice, wheat, corn, and soy. Very, very important in these days because we talk about climate change. These nutrient losses have a large effect on the health of children. So what do you have to say about it?
The food that we eat or the food that our parents ate or our grandparents ate and eventually what our children will be eating is very different. We may be eating the same crops, but the nutritional content is far more depleted as the generations go by. There are many reasons for the nutritional depletion. One is the soil itself is depleted. The agriculture has ribbed the soil of its nutrients. Our foods are genetically modified and hybridized. The type of wheat and rice we're eating now is a genetically modified version of the original grain. So is the rice also. Also, these are hybrid plants. These are plants that have been engineered for, maximum amount of output in terms of the grain that has to be extracted from them. So obviously, there is a huge amount of depletion of nutrients, and especially things called micronutrients in crops over generations. So from what our forefathers had to what our children will have, probably it'll be not even half of the nutritional value of what they could consume. So therefore, also our food is industrially more processed, which means that it's going through milling and refining and polishing far more than it was done before. So all of it is ripping our food of nutrients. And that is one reason why so many of us have mineral vitamin deficiencies. In fact, if I just look at water, Shankarji, the water that we are drinking as against natural water, even our water is depleted. The reverse osmosis that we use in our homes is a disruptive technology. It removes the minerals from the water that we should otherwise have. So that is why everybody is low on folic acid and vitamin B and zinc and magnesium, and we need to sort of supplement them through micronutrients. But for children, I think one of the things that can be done is that as children are growing up, instead of only giving them wheat and rice and starchy vegetables, if we could add more nuts and seeds, more seasonal fruits, more millets like ragi, jawar, all that in their diet, then we can to a certain extent replenish these deficiencies. We can correct them to some extent. So I think one of the things that people have realized is that they can't be eating wheat and rice all the time. They have to eat much healthier grains and cereals and millets. They've also realized they can't be eating polished dals and polished grains. So they have to eat the whole lentils and beans. And they have to eat, pomegranate, for example, Shankarji, is supposed to be one of the most ancient fruits. It has a very old, it was, I believe, in India, it was discovered many thousands of years back. and pomegranate fruits like those, like berries, pomegranate, things that have not so commercially popular are far more nutrition dense. So I think more millets, more nuts and seeds, more fruits, seasonal fruits, more local vegetables can somehow close that gap which we are experiencing because of our main crops getting depleted of nutrition, which, as you correctly pointed out, is wheat, rice, corn, and soy, which is largely what we eat, as our staples.
I'll come back to you, Manjari. I'll now move on to Dr. Sharvari. Dr. Sharvari, are you available? Yeah. Dr. Sharvari, before I ask you a question, I was just curious to know how do you pronounce your second part of the name?
It's Dabhade, sir. Dabhade.
Okay. I always thought it was Dabhade, so there is an A in between.
Yes.
Okay, thank you. Now I will ask you a question on climate itself, climate shocks, for example. What is happening in Assam now? These extraordinary events, from heat waves to cyclones, that would not have happened without atmospheric accumulation of greenhouse gases, disproportionately affect children more than adults. This can begin even before birth with exposure to extreme heat. Air pollution also reduces a child's prospects of well-being even before they are born or infancy onwards. Further, the absence of vital nutrients can damage a child's development in life. So what are the options? Do you agree with this views, and what are the options?
Okay, so over the period of years now, we've seen that there are a lot of drastic changes that are happening, especially with the weather. So we see extremes of heat, we see extremes of rain and winter, and so on. There are a lot of factors that directly or indirectly show some effect on the health and the well-being. Also, not just about children, but even for adulthood or adolescence, in each and every way, the entire cycle of environmental changes, including the food chain that we are following, or even the normal circadian rhythm on which the hormones kind of get secreted. And so there is an imbalance in all of those terms, and development per se has taken a toll. So hence, not just children who are born or who are in the younger days of their lives, but also people who are aging in a different way than they used to as compared to the earlier days. Entirely, the environment should. The way it is changing now, there are a lot of things that affect the development of oneself. So, like it was always said, the survival of the fittest. That is how we have been evolved over the last whatever number of years. But even now, we are still evolving, and now with such extreme, harsh environmental changes and the weather changes that we see, I'm sure there are a lot of things that are going to be evolving, maybe for the good, for the better, or maybe sometimes for the worse. Especially with children, we have seen that there are a lot of neurodevelopmental deficits that now are also can be related to the extreme amount of exposure to pollutants, be it water pollutants, be it air pollutants. Even in our homes, we see there are a lot of sources of pollutants which we tend to ignore in our day-to-day life, which eventually have some impact on our health. And hence, people who are in their fertile age also tend to get exposed to this over a number of periods. Hence, we are seeing a reduce in the percentage of fertility. Also, I'm sure you must have read about it. Recently, India has seen a dip in the fertility rate. I don't know if it's a good thing or bad for a population, but whatever it is said and done. So definitely that there are a lot of things that are changing in our body, not just for a future generations, but even at the present current situation that we are facing nowadays involves a lot of effort for the body to combat and to maintain the health. Hence, it is not as easy as it used to be. But in the coming generations, the way that we can probably modify all of this is by accounting to the pollutants, accounting to the inputs that we are giving towards the environment, what we are doing for our own well-being, making sure that we are aware of what can be hazardous in the near future and what not can, I think, prevent us from the extremes impact on the health, especially the environment and the weather-related impact.
Yeah, that's wonderfully put. I think we are moving to an era where things may become more difficult than it is easy now. We are running short of time, so in one sentence, I would like all the speakers to speak about, give their view on monsoon and health, starting with you, Dr. Sharvari.
Sir, I think I've already said, and I think that is what I'm going to emphasize on the same point, that we all should maintain hygiene, physical hygiene, also meditation, yoga, as correctly said by Dr. Saurabh. I think it is Ayurveda is an integral part of our society, and I think we all should incorporate it in some or the other way. Not that I'm saying that as a doctor, but I think all of us have had good help with Ayurveda. Also, as rightly said by Ms. Manjari, that diet is very important. So please, let's focus on the diet first. Let's take whatever nutrition that we can out of the contaminated, pollutant exposed foods that we have now, and let's stay healthy for everyone. I think that's going to be my message. Thank you.
Dr. Kiran, your message on monsoon and health.
I will just tell the patients or anybody who is following it, follow the EARN principle: exercise, right attitude, rest, and proper nutrition. And yes, be in touch with your doctor. Don't leave your medicines. Be compliant. And that is the one of the healthy way.
Dr. Sharma.
Thank you very much, everyone. Just one sentence. Please have a disciplined lifestyle. That's it. Just have a disciplined lifestyle. Believe me, we are very intelligent. God has given us very good intellect. We know what's good, what's not. Please don't follow mistaken intellect. Follow your instinct. Have good food. And yes, regarding the exercises, in this season, please don't overexert yourself. Good exercises, yoga, running, everything's fine, but don't overexert. This is a very important, otherwise that will not be good. Otherwise, I hope you all will stay healthy, and in the next season, we'll talk about more regimes about the season, and health is good for us.
Ms. Manjari? Please unmute yourself.
I'm sorry. I was saying, as Dr. Kiran also said, eat well, exercise enough, have the right attitude. Rest is equally important. I believe now sleep is highly researched, and it's going to become the most thing we're going to talk about a lot. One of the things that we've seen with our patients is sometimes, they become obsessed with being healthy. So it's good to have a balanced approach to health, exercise enough, be good, of course, be disciplined. But sometimes a lot of people are overdoing it in the sense they follow extreme measures. They want to look a certain body type. They don't want to defy aging. So it's good to try and anti-age, but you have to also respect your age, your environment, the genetic background that you're born to, and also respect your body for cues. If it's asking for rest, give it rest. If it's asking for food, give it nutrition, with the right type of nutrition. So don't starve too much. Don't overwork yourself. Don't get obsessed with the idea of being healthy, which is the other extreme that we are seeing now with a lot of people that we see in our clinical settings.
Thank you very much. I think wonderful messages on monsoon and health. And I will take you back to ages where probably our rishis and others followed what is called the Chadurmasya, where they took special care during the monsoon season. I think that is, though we cannot take such care, but I think this is the time for us to rejuvenate the body and also at the same time be careful and disciplined. Thank you very much for this wonderful session. It was wonderful having all of you on this particular show on monsoon and health. Thank you very much.
Thank you. Shanti. Thank you. Kishore.
I will now hand it over to Kishore to take it further.
थैंक यू सर। अब आज के एपिसोड को समाप्त करने की इजाजत दीजिए। आज के शो में शामिल सभी विशेषज्ञों का आभार व्यक्त करते हैं जिन्होंने हमें बताया कि मानसून की बीमारियों से कैसे बचाव करें। बहुत अच्छी बातें बताई और आई एम श्योर कि अब इसको फॉलो करने से हमें काफी फायदा होगा। अगले रविवार को हम फिर मिलेंगे हेल्थ फॉर ऑल कार्यक्रम में एक नए विषय और कई डॉक्टरों और वेलनेस एक्सपर्ट्स के साथ सुबह 8 बजे से 11 बजे यूट्यूब और फेसबुक पर लाइव। नमस्कार, अपना ख्याल रखिए।